Al-Khair and welcome to today's forum titled Navigating the Climate Change Health Migration Nexus. This event is hosted under the CLI Health Program and organized by the Global Health Institute at the American University of Beirut in partnership with the International Organization for Migration Regional Office in MENA. My name is Nadine Sabra. I'm a program manager at AUB GHI and I'm honored to be the master of ceremony for this event. To open today, we are pleased to start with the opening remarks from Dr. Shadi Saleh, the founding director of the Global Health Institute at the American University of Beirut.
Good morning, Sabah al-Khair. With these opening remarks, since most people don't remember what we say, so it will be very brief. And what usually happens is that there's an interest in a global issue and everybody seems to collate around it. And a few years ago it was refugees and refugee health, so everybody was working on refugees and refugee health, which is still a necessity. But now it's climate change. But unfortunately climate change is a real threat to society in so many assets. And one of the assets that is relevant to us here is the issue of health. So the effect of climate change and health, although not intuitive as climate change and catastrophes, but it's rather important because what will happen with climate change is that there will be an increase in certain diseases, there will be a pressure on healthcare systems to be able to absorb the additional climate-related illnesses. So all of this requires preparation from a healthcare system perspective and from a population perspective. However, one of the things that we have decided at GHI to add to that formula is the whole issue of social justice and social equity. So it's a nexus of climate change, health, and social justice and social equity. لأنه unfortunately, as in most global health challenges, the people that get affected the most and are the last to receive any support are people who tend to be poorer, tend to be disadvantaged, including refugees and displaced population, as well as, in many instances, unfortunately, women and children. So that's why our program within GHI, which is the CLI Health Program, is a program that focuses on the nexus of climate change, health from a population health perspective and a healthcare system perspective, and also social equity with a lens on displaced populations, refugees, disadvantaged population, and so on and so forth. And it is in that sort of sphere or ecosystem that we had the pleasure to partner with very important and dear friends of ours and sister institutions, including within AUB, the IFI, the Isam Faris Institute for Public Policy, because we can do research from now to the moon, but if we don't translate it into policy action, it remains irrelevant. And second, with UN agencies, our partner IOM, who focuses on displaced population and migration, and they are a very important nexus for us when it comes to health and displaced population, with UNICEF, with the relevance in terms of youth, women, and so on and so forth, and absolutely with UNDRR, who we are very fortunate also to have with us as partners now and in the future, because it's at the core of what they do, and many other partners who are with us in the room. So again, for us, it's not about a focus on climate change as a standalone, but how to prepare society from population health, from a global health perspective to what is coming, and we see it now in Lebanon with the issue of water and climate and so on and so forth, but also a very eager lens on the whole issue of social equity and social justice. So it's in that sort of frame that I hope we will have a very interesting day with very interesting panelists that we have today with us, and also a discussion on how we can move the agenda forward in a meaningful way. So we don't want to attend yet another event that nothing happens out of it. نحن what we're trying to do with our partners, with IFI, hopefully with UNDRR and with UNICEF and with all of you, is to make this practical and also operational. So thank you so much for being here, and we're looking forward to listening to you and to learning from you and to working together. Thank you. يعطيكم العافية.
Thank you, Dr. Saleh. We will now hear from Dr. Michela Martini, Senior Regional Thematic Specialist on Migration Health from the IOM Regional Office for MENA.
Thank you, Master Ceremony, and good morning. Or actually, as you say, bonjour, kifak, ça va. It's the only countries where you greet in 3 languages. On a personal level, it's really, really nice to be back. I lived in Beirut. Every time I come, my heart is opening. And I'm really pleased also to open this important event with the American University of Beirut. Thank you for the great organization, the Global Health Institute. As you may know, we are going to sign an MOU today at the end of this day, which is mark an important commitment from both organizations to advance the agenda on climate change, health, migration, but also other areas of the public health. So allowed me on behalf also of my regional director, Othman Belbezi, that unfortunately cannot be able to be here, but is strongly supporting this event and this collaboration. I'm representing him, so allowed me also to read some thoughts from him and myself as well. So welcome to this important symposium, Navigating the Climate and Health Migration Nexus. So it is a true pleasure to open today the discussion held in collaboration with the American University of Beirut, which we believe is a valuable partner and leading agency also in the research, especially in the Middle East and even beyond. So today's event marks a significant step forward, which is much needed in our conversation. And this is the intersection of 3 of the most defining challenges of our time: climate change, health, and also migration within the umbrella of the social justice, as was said. Climate change is a health multiplier, is a threat multiplier, and then we know. And it may undermine, and it is already undermining in many countries, success that the public health has done, reversing, going back also to some of the achievement in terms of health indicators. And is also climate change threatened some efforts to advance the migration agenda. It poses fundamental threat to human health, as we know, both directly and indirectly, increasing risk of deaths, communicable disease, respiratory tract infection, maternal child health, etc., and further so on. So climate change also affects the physical environment and the systems, impacting social determinant, but also employment and working environment, like disruption of agriculture, lack of water, etc. So it's a very complex umbrella. But in addition, especially as IOM, we are monitoring, we are tracking how climate change is affecting and maybe generating new trend of migration, which is important. And this is also encourages researchers to look at these angles. So why people is moving because of the climate change. I know from research point of view it's extremely difficult to disaggregate why people is moving from climate change toward other motivation determinant, but this is an important. We have already some evidence, we need to build on that. We see, especially in our region, a growing number of people that they are moving due to environmental degradation and the climate change, water scarcity, etc. This is one of the important focus, and I think we can further expand together with the collaboration of the researchers. And why the impact, and we know climate change, as I said, is undeniable, is under the eyes of all of us. The intersection about the 3 sectors, migration, health, and climate change, remains still understudied. And this is why collaboration with the university for us is extremely important. It's understudied globally and also in MENA. And if we look at the gender aspect of these three nexus, there are not publications from this area, from gender, and there are very few globally. So I encourage, as as a researcher, to be pioneering also in this new area that can contribute significantly to the scientific society as well, and looking at new area and new trend for research. And this is why the event today is extremely important for us, and it matters. So, with the support of all of you as a researcher, the UN agency, and thanks for coming also our partner agency, UNDRR, and where we are conducting a joint project with WHO, UNDRR on climate change, health, and migration. It's a pioneering project funded by the Migration Multi-Trust Fund, which is very competitive funding mechanism within migration portfolio. So thanks also for your collaboration. So with together, and I can see in the room, we complement each other with the expertise. And today meetings, it can be an opportunity also to look at ahead how we can integrate our expertise. So climate change is not a distant threat, as we know. It's already reshaping migration patterns, overwhelming the health system and challenging the resilience of community across the region. So the science is clear from certain aspects, and the human cost is visible. So the question to get together is to see how are we responding, how are we addressing. So we believe as IOM that migrants also are agent for resilience and they can be partner in the solution. So we also encourage the engagement and working with the community level. And with the right system in place, we can really reduce the risk, safeguard health, and manage mobility in a way that can be safe for all of us. Not only believing in the true partnership, we can go ahead together. So I thank you again, and looking forward to the debate, discussion of today, and thanks.
Thank you, Dr. Martini. Next on the agenda, we'll proceed with a presentation on the CLI Health Program at the Global Health Institute with Ms. Noor Al-Arnaout, Associate Director of the Global Health Institute at the American University of Beirut. Since the establishment of the Institute in 2017, she has overseen the design and implementation of multiple large-scale initiatives focused on health, capacity building, and institutional strengthening. She has also spearheaded the expansion of the operations of the Institute to 9 countries in the MENA region. Her work has primarily focused on underserved and vulnerable refugee populations in fragile and resource-limited settings. Noor has published extensively about health interventions implemented in the MENA region. Her research emphasizes on gender equity and equitable access to health services. She is a certified project management professional from the Project Management Institute and holds a master's degree in public health from the American University of Beirut with a specialization in health management and policy. Noor is also an inductee of the Gamma Delta chapter of the Delta Omega Honorary Society in Public Health. Noor, the floor is yours.
So good morning, everyone, and thank you for joining us today. Originally, I wanted to start talking about the CLI Health Program right away, but then I realized that there are many people, many new faces here that may not know a lot about the Global Health Institute. So this is why I decided to start by telling you more about the Global Health Institute. So the Global Health Institute was established here at AUB in 2017, and it is the first such institute in the MENA region, and among very few in the Global South. There are 2 main mottos that we operate with as part of the Global Health Institute. The first is that for so long we were actually only implementing partners for leaders in the global north. So most of the projects used to be designed in the global north, financed by the global north, and we used to be, as global south, implementers of these projects. The Global Health Institute, one of these revolutions that it made is actually that the global south is capable of designing projects from scratch, implementing these projects, assessing their effectiveness, putting recommendations to policy, and designing tailored capacity building programs around these subjects, all based on the global south. So this is one of the major notions that we work with at the Institute. And the second is our focus on contextualized solutions, because who more than us knows about the MENA region, right? So this is why one main focus of our work is creating contextualized solutions that are culturally relevant, that are tailored to the context of fragility, of conflict, that is a characteristic of the MENA region. So currently, there are three main divisions at the Institute. One that is purely focused on research, but with practical implications for policy, and this is why we work closely with policy partners. The second is the Academy division that is mainly focused on training and capacity building, and we have different offerings as part of this division. And the third is the Assist division that is mainly about working directly with the community through civil society organizations in the MENA region and beyond. And this happens by institutionally strengthening the organizations to be able to deliver better services to their communities. Now, why we decided to establish the GHI Health program last September in 2024? There are so many global frameworks and declarations and agreements that are more and more shedding light on the interlinkage between climate change and health. One main framework is the Sendai framework for disaster risk reduction, and the Sendai framework actually recognizes climate change as a driver of disaster risk and urges risk-informed health policies, multi-hazard early warning systems, and integration of epidemic and pandemic preparedness into disaster risk reduction planning globally. It also calls for strengthening health systems nationally, including primary healthcare systems and surge capacity, and promotes investment in health infrastructure. So the Sendai framework is one major framework that is actually highlighting clearly on the interlinkage between climate change and health. The UNFCCC is another framework, and it has related agreements such as the Paris Agreement, and we'll talk about this in a few minutes. And there's also the most recent UN Declaration on Climate Change and Health, which is also known as the COP28 Declaration, and that is, or that has been recognized as the strongest and most formal UN-led commitment to date linking climate change and health priorities. So the UNFCCC, it has shed light on 9 categories of health risks arising from climate change. And here we're talking about waterborne diseases, about vector-borne diseases, heat-related illnesses and death, mental health impacts, displacement and health service disruptions, and many others. So these are, clear examples that are telling us that climate change is being recognized as the paramount health challenge of the 21st century. Now, why we are also focusing on social justice as part of the GHI Health program? This is because, as Michaela said, there is very little evidence on the disproportionate impact of climate change and health. But there is a bit of data on the aspect of, social justice, the gendered impact of climate change and health, and others. And here we're talking about, unequal burdens of diseases held by marginalized communities and vulnerable populations who often have less access to health services, who live in rural areas with minimal people, access to resources, and so on. We're talking about climate-induced migration and displacement that also affects health and others. And in terms of the gendered impact of climate change, we talk about increased rates of gender-based violence. We talk about the great impacts of climate change on the health of pregnant women specifically, and many other aspects, just to name a few. Now, why is all of this relevant to the MENA region specifically? The MENA region is actually, for you who don't know, it's predicted to have the highest average temperature increase in the region and increased number of extreme weather events in the upcoming years. The region is warming faster than the global average, and over 60% of the population in the region lives in areas of high and very high water stress. Climate change is also a threat in the MENA region because it's also inducing migration, it's inducing displacement, and the whole aspect of ongoing and protracted crises and conflicts, governance challenges, inequities, and the social and economic status. All of this is actually contributing to exacerbated implications of climate change on health. And this is why we decided at the Institute to establish the GHI Health Program. So the GHI Health Program, it aims to explore the nexus of climate change, health, and migration with a focus on vulnerable communities in the MENA region specifically. The program, it focuses on these three aspects at multiple levels, but particularly we have a focus on healthcare facilities, health systems, and the communities, because we believe that these three levels are key to actually create more resilient systems and communities in our region. Currently, there are three ongoing flagship initiatives as part of this program. The first is revolving around the climate resilience of healthcare facilities, and this is actually based on the WHO guidance for climate resilience healthcare facilities, and in this we're sort of adapting this guidance to make it tailored to the MENA region, and are going to actually implement it at the level of primary healthcare centers in three countries, including Lebanon, Egypt, and Morocco, just to better understand the level of preparedness and current status of resilience of these healthcare facilities in these countries. The second, as part of this, is most at the health systems level, and this is, we're working with our partners, the ISAM Fares Institute, and we're actually checking what are the existing policies that are related to climate change and health in the MENA region, what are the existing national strategies, how integration and adaptation is taking place, and so on. The second initiative is mostly revolving around the communities and specifically vulnerable communities. And this initiative is mainly being conducted in a qualitative approach, and it aims to document narratives from the most vulnerable communities, particularly women, on the impact of climate change on their health, how they are being affected differently than men, how are they being affected differently than those living in urban settings and wealthier settings, and so on. And the third is the effort that we are doing in terms of capacity building on climate change and health. And for that, we will be soon launching in Q4 of 2025 our online self-paced certificate on climate change and health. And it includes 4 courses, one that is foundational, another that is focused on health systems, another that is focused on health policy, and the last one that is focused on social justice, gender, and equity. So for those interested in this certificate, you can see a QR code here. You can scan it and be directed to it. So thank you so much for joining us today, and we hope you engage with us in this fruitful discussion. Thank you.
Thank you, Ms. Al-Arnaout. We will now get to understand the interlinkage of climate change, health, and human mobility from global and regional policy perspective with Ms. Masako Ueda, Regional Thematic Specialist on Climate Action and Mobility from the International Organization for Migration, Regional Office for MENA. With over 12 years of professional experience with IOM as the UN migration agency in various countries in Asia and MENA, Masako has strong knowledge and skills in climate mobility and broader migration management issues, including drivers of migration, protection risk linked to disaster displacement, and the relevant policy discussions. Previously, Masako worked for a bilateral donor agency and international NGOs, including the issues of child protection and social security. In her current portfolio, Masako works closely with IOM country offices in the MENA to support the development and implementation of country and regional projects to address the interlinkage of human mobility, climate change, and environmental degradation, while also promoting the importance of the issues in the region through engaging in policy dialogues. Ms. Masako, the floor is yours.
Sabah, good morning. It's my great pleasure to be actually back in Beirut. As the colleague kindly introduced, actually when I started my career, I had the opportunity to come to Beirut. So 20 years ago, I was here, and now actually I'm back. So very happy to be here. And I would like to start really thanking the Global Institute, Health Institute of American University of Beirut for partnering with IOM, International for Migration, IOM, for organizing this important symposium. And I would like to really thank all of you to be here for discussing these important interlinkages between climate change, health, and migration. So as a part of the scene setting, I would like to talk about these interlinkages, particularly from the global policy point of view, and focusing on this UNFCCC, which Dr. Noura already mentioned. So first, I would like to refer to some scientific assessment by the UN Intergovernmental Panel on Climate Change. I think many of you know IPCC assessment report, and IPCC worked to advance scientific evidence of the climate change induced and affected by the human activities. And their assessment reports are regarded as most authoritative scientific evidence of climate change. As early as 1990s, the IPCC pointed out the climate change impact on human migration and how it might impact the health and other services in destination areas, while also displaced population would face significant impact on their health and also welfare. Scientific evidence of the climate change induced and affected by the human activities. And their assessment reports are regarded as most authoritative scientific evidence of climate change. As early as 1990s, the IPCC pointed out the climate change impact on human migration and how it might impact the health and other services in destination areas, while also displaced population would face significant impact on their health and also welfare. Their latest report, the sixth assessment report published in 2022, has a dedicated chapter on health, well-being, and also changing structure of communities. And this chapter indeed confirms these interlinkages. As you can see this point from the IPCC AR6 chapter 7, which is the health chapter, it's point out and confirmed how climate hazard is becoming a growing driver of involuntary migration and displacement, but also pointing out how health impacts are also increasing as well. And importantly, it's noted that these impacts are interconnected and also inequally distributed because it's linked to the person's exposure and vulnerability level as well. Because of this inequitable distribution of the impact, the refugees and involuntary migrants are often experience higher exposure to climate-induced health risks. Indeed, disaster displacement triggered by extreme weather events increasing globally and also in the MENA region as well. So according to the data from the Internal Displacement Monitoring Center, globally, year 2024 recorded the highest number of disaster displacement in the last decade, reaching 45.8 million people being displaced newly due to the disasters. And 99% of this displacement were triggered by extreme weather events, such as floods, drought, wildfires, and storms. In the MENA region, the same year, almost 800,000 people are newly internally displaced due to disasters, again triggered by extreme weather events. The climate change are also impacting the involuntary migration, especially because of the slow onset events impact on the livelihood and habitability, such as sea level increase and impact on the livelihoods. So such migration is currently mostly happening internally within their own countries, especially from rural to urban areas. But we also started seeing the emergence of the cross-border mobility as well. Many of you may know the World Bank published this famous Groundswell report in 2021, which point out by 2050, over 260 million people could move within their own countries as a climate migrants because of the impact of slow onset events. And this figure for North Africa alone is 19.3 million. In Eastern Horn of Africa, IOM is tracking the number of people who are exiting and entering Somalia to better understand what are the drivers of the mobility behind. So that's a cross-border mobility. So in December last year, we recorded 19,396 people left Somalia, so it's a mixed nationalities, to other Eastern Horn of Africa countries, but also to Saudi Arabia. And 51% of them said they are forced to move, primarily because of disaster and food insecurity. So we can see the climate-related factors are also becoming the drivers behind cross-border mobility as well. Now, coming to how health and human mobility are positioned within the UNFCCC framework. We already heard from Dr. Noor that UNFCCC framework recognizes health as important impact of climate change. So how about human mobility? The convention itself also recognizes the health as one of 3 key categories of adverse effects of climate change. But the convention doesn't talk about migration or human mobility. 16 years later of the convention, at COP16, the parties have adopted the Cancun Adaptation Framework. So this adaptation framework focuses on enhancing the adaptation actions to reduce vulnerability and enhance resilience, particularly focusing on global South countries. So this was the first time that migration language appeared in a UNFCCC document. It's mentioned and encouraged the parties to coordinate and cooperate to address climate change-induced displacement, migration, and also planned relocation at all levels. At COP19, the Warsaw International Mechanism for Loss and Damage associated with climate change impact was adopted by the parties. And this is also important because it signifies that climate change is indeed leading the impacts which are often irreversible, such as degraded health and also human mobility, such as displacement. And this framework recognizes both health and human mobility as the form of non-economic losses. And indeed, the task force was developed under this framework, focusing on displacement, how to address and about displacement. Paris Agreement was already mentioned by Dr. Noor. So Paris Agreement also recognized the right to health and the right of migrants as important principle for the parties to take into account when they take a climate action. Related to the loss and damage, as I mentioned, loss and damage framework already recognized health and human mobility as forms of non-economic losses. And now that the operationalization of funding for responding to loss and damage is ongoing, and once this fund is set up, we hope the country which are suffering from loss and damage can really access funding to address both health and human mobility. One of the key negotiation topics which are currently going on and discussed further at COP30 is Global Goal Adaptation Framework. This was agreed at COP28, and since then, globally, the indicators for this adaptation framework is being discussed to agree upon up to 100 indicators. Health is indeed positioned as one of the 7 thematic areas of this framework. And currently, the draft indicators that are being discussed include 2 indicators which are related to human mobility in relation to health. So as you can see from these draft indicators, it's actually look at the number of refugees, migrants, persons displaced by disasters. And the second indicator is looking at proportion proportion population exposed to hazard, and who also encountered barriers to accessing medical care to be disaggregated by sex, location, and also displacement. Now, I would like to introduce you to our approach as IOM, as a UN Migration Agency, how we are addressing this intersection, as well as the intersection with health. So we've been at the forefront of addressing intersection of climate change, environment, and migration, including the impact on the migrants' health due to the climate change, through our policy, operation, and advocacy efforts. And in 2021, we published this institutional strategy looking at this nexus. And this nexus, this institutional strategy is underlined by 3 solution-oriented objectives. First, we develop solutions for people to move. As my colleague Michaela mentioned, migration can be an effective adaptation strategy if it takes place regular, safe, orderly manner. And we recognize that people still move in the context of climate change for different reasons. So we work with government to ensure that the people have access to regular migration pathways, including the benefits of remittances sent by labor migrants, as well as diaspora engagement as well. Second solution is we develop solutions for people on the move. We already discussed a lot about how migrants, IDPs, refugees are vulnerable to health risks and other risks related to climate change because of their pre-existing vulnerability. So we focus under this objective to ensure that they have access to services to build resilience against climate change impact, including disaster risks. Final objective is we develop solutions for people to stay. We work for making migration a choice rather than necessity by building resilience and also addressing the adverse driver. So here we also emphasize a lot on disaster risk reduction as well. We apply this approach, 3 solution-related objectives, to addressing the interlinkages between climate change, health, and also migration. We have already heard from Dr. Noor about the importance of Sendai framework as the policy related to disasters, climate change-related policy we discussed, and there are also important health-related declaration, convention, and human mobility-related global framework. So our approach is to really align our solution-oriented objective with those global framework. Here I would like to particularly highlight the importance of this global compact for safe, orderly, and regular migration as the first ever UN negotiated global agreement focusing on international migration. And this is signed by over 160 countries. So this GCM, for which IOM in fact, act as a global coordinator, has 23 objectives, all related to international migration. And out of these 23, 4 objectives were particularly relevant to today's discussion. The first objective is focusing on importance of disaggregated data. Second objective is calling for minimizing adverse mobility drivers, including climate change impact, but also access to adequate healthcare services. Objective 6 is calling for the member states who have signed the GCM to ensure the migrants have access to the highest attainable standard of physical and mental health. And Objective 15 goes beyond and encourages the member state to incorporate the health needs of migrants in healthcare policies and plans. And this GCM is strongly anchored in the Sustainable Development Goal Target 10.7, focusing on responsible and well-managed migration policies. Finally, I would like to introduce briefly IOM's regional effort in terms of policy dialogue, engagement, advocacy, and also programming to address this intersection of climate change, health, and migration. So in last 2 years, we have organized 2 regional workshops. One was focusing on the Gulf sub-region, particularly the impact of heat stress linked to the climate change on Gulf citizens, but also temporary contractual workers from abroad. So the workshop resulted in 11 recommendations, which took place in leading up to COP28 in Dubai. And those recommendations also helped the Gulf countries to prepare their engagement at COP28. And importantly, recommendations highlight how it is important to link health adaptation planning with urban planning, because most of the Gulf countries are highly urbanized. Role of employers and businesses to protect workers from the effects of climate change, particularly heat stress, and also reinforcing the government policies. Last year, in leading up to COP29, we organized another regional event. This time, it's included all MENA countries to discuss how we can enhance regular migration pathways for accelerating climate action. As I mentioned, migration can be an effective adaptation strategy if it takes place in a safe, regular, orderly manner. So one of the topics we discussed in this event was health and climate resilience in regular migration pathway. The migrants often see the improved health outcome if migration takes place in a safe, orderly manner, but they also face new health risks in the destination countries, such as heat stress linked to the climate change. So this was discussed in this event. We also do a lot of advocacy and publish the policy brief, and especially this policy brief related to this Nexus is led by my colleague Michela, and we recently published this policy paper called Positioning the Climate Change Health Migration Nexus in MENA, and especially presenting the 7-step framework of how to address policy and programmatic coherence. And finally, as it was already presented by my colleague Michela, we are having this multi-country program jointly with WHO colleague and UNDRR colleague in Lebanon, but also Jordan and Iraq. And this program aims to strengthen synergies between climate adaptation and disaster risk reduction in the MENA region through mainstreaming gender-sensitive human mobility lens into public health adaptation policies, as well as the DRR strategies. So just to finalize, just a second, sorry. I think we have seen that, especially through the IPCC report, that, and the discussion so far, that it's really underscored that this interlinkage is not deniable. I think globally, it's recognized, and it's increasingly recognized in the UNFCCC processes as well. But we still need more region, country, and context-specific evidence and data to feed into national, subnational climate and health policies, including nationally determined contributions and NDA, National Adaptation Plan, and also design and implement actionable solutions. And these evidence generation, policy formulation, programming actually require scale-up access to finance, particularly climate finance. And it's important to know that both health adaptation and addressing climate mobility are significantly underfunded currently in relation to climate finance. And MENA region is one of the regions which have least access to climate finance. So it's really important to advocate for increased and scale-up access to climate finance. So I really look forward to today's discussion, knowledge exchange, so as to make sure that no one is left behind in our fight against the climate-induced health risks. Thank you so much. Shukran jazil.
Thank you, Ms. Masako. We now move to our first panel discussion titled Navigating Evidence Gaps and Policy Needs, Aligning Research Priorities on Climate, Health and Mobility. This session is moderated by Dr. Michela Martini, Senior Regional Thematic Specialist on Migration Health from the IOM Regional Office for MENA. Dr. Martini is a specialist in migration health with over 25 years of professional experience. She began her postgrad career as PhD fellow in the US, where she conducted independent research in the fields of cancer and HIV. She later transitioned from lab science to focus on anthropological medicine with an emphasis on the psychosocial impact of complex medical treatments and the behavior change among vulnerable population, including youth and migrants in emergencies and post-conflict settings. In her current role in IOM MRO in Cairo, Dr. Martini provides provides technical leadership to government in strengthening health systems for migrants and host communities. Her work includes support in conflict-affected and protracted emergency contexts, the development of core capacities under the international health regulations for epidemic and pandemic preparedness, and technical guidance on the health dimensions of climate change and labor migration. Dr. Martini holds master's degree in pharmacology, public health, and gender studies. Dr. Martini, welcome to the panel. I would also like to invite our esteemed panelists to join us here, please. We have with us Ms. Yara Murad, Assistant Director from the Issam Fares Institute for Public Policy and International Affairs from the American University of Beirut, Dr. Kinza Khomsi, Climate, Air Quality and Environmental Health Expert from Morocco, Ms. Rola Majdalani, Climate and Sustainable Development Expert from Icarda, Lebanon, and Dr. Lucia Barcellini, joining online. She's a Technical Officer in Migration and Health from the World Health Organization, EMRO office.
Can you hear me? Thank you, Master Ceremony. And it's again a pleasure for me to start the first panel discussion. As never as before, these interesting and heterogeneous discussions are needed to advance the agenda. We are here and estimated speakers and from the academia, UN agency, but also experts in the sector. So through this panel, we are going to navigate how policy can help to bring it forward and operationalize and help the operationalization. And we are going also to discuss gaps in research, but also the actual impact of climate change on health. And through the WHO presence, also what the WHO is doing in this regard. So without any further ado, and Jafar helped me also on the timekeeper. I know we are quite restricted. So the speaker, it's a very interactive section. The panelists will have 5 minutes. I'm going to address some questions for all of you. And I hope you can answer in 5 minutes time. So according to the agenda, allowed me to introduce the first speaker, Dr. Yara Murad. Yara Murad is the Assistant Director of the Issam Fares Institute for Public Policy at International Affairs at the American University of Beirut, where she oversees research and policy program across sustainability, development, and regional affairs. She also manages the Refugees Research and Policy Program, leading initiatives that inform national policy on displacement in Lebanon and in the Arab region. IFI also serves as the Secretariat of the Lebanon Policy and Research Network on Displacement. Dr. Yara holds a Master of Public Health within a focus on health management and policy from AUB. Thank you for coming, and we are looking forward to gain from your experience. My first question to you is from a policy perspective, since you are leading the platform of policy, and we heard how policy is important. What steps should be taken to ensure national and regional policy frameworks better reflect the interlinkages between climate change, global health, and migration?
Thank you. Thank you, Michaela, for the introduction and for this important question. Allow me to just first start by thanking the organizers, IOM and GHI, for inviting IFI to contribute to this very timely discussion. For those not familiar with IFI, the mandate of our institute really is to bridge the gap between academia and policymaking. And we do that with high-quality research that is translated later on into evidence-based policy recommendations. Of course, all of this is within a shifting international and global context, as we all see. And of course, the climate change, health, migration nexus is very high on our agenda. And we work very closely on this issue with GHI and within the CLI Health program. So now back to your question. As many of us are aware and was mentioned in the presentations today, the MENA region is frequently cited as the most vulnerable region with regards to the impacts of climate change. And the region is warming up twice as fast as the global average, as also mentioned. Currently, 60% of the population is living in either high or very high water stress compared to the 35% global average. However, the climate change issue or the climate change problem often takes a back seat. So usually the attention is given to more immediate challenges such as conflict, economic instability, social unrest, which the region unfortunately suffers a lot from. And as a result, the governments in the region are often unprepared to deal with certain crises. And in fact, those poor and inadequate policies in some regions or some countries often exacerbate the environmental problems that we face. We have extreme weather conditions such as floods, of course, storms, air quality, food insecurity, among many others. And these are all aggravating the public health challenges faced in the region. Respiratory problems, heat-related illnesses, the spread of waterborne diseases are all increasing and very frequently. And of course, as was mentioned, it's the most vulnerable that suffer the most. So those in rural areas, the poor, the women, the children, the elderly, who are feeling the most impact. And here, of course, climate-driven migration brings in the vulnerable population of migrants. And it's another critical issue, as we have the droughts and the extreme weather is pushing people to migrate and move to areas beyond their areas of living. By the end of 2024, the MENA region had hosted 16.6 million IDPs, and this figure is the highest ever recorded for the region, and it's 20% of the global total. And if we look into the causes of these displacements, of course, conflict is a major reason, but still, you have a big number of 600,000, I think that was mentioned in the presentation as well, that is due to disasters. So we really need coordinated responses. We need a lot of buy-in from the policymakers in order to make healthcare services also accessible to these displaced people. So maybe I can start at the national level, what can be done, and from our experience at the Institute as a policy institute. We definitely need to focus on first strengthening the healthcare systems we have. And I know that GHI works extensively on this issue, and we've worked a lot with them on it. We need to invest in the healthcare infrastructure so that we can respond to these climate-related pressures. For example, there could be heat stress treatment centers. There could be better systems to anticipate certain outbreaks so that we can respond better to these shocks. And of course, we could think of more creative ideas, and such as climate-urban planning. For example, in Lebanon, we know that only 11% of our public space is green. So already by tackling this issue, we know that we can relieve the impacts of this climate change. So really, to sum it up, if you want, on the national level, we need to better incorporate this interconnectedness between climate change, global health, and migration. And we need to adopt it in a more multidisciplinary approach. So we need to mainstream this issue, the climate change adaptation and disaster risk reduction strategies. We know there's a lot of effort. We mentioned a lot of frameworks in the presentations, but we really need to make sure that these are incorporated into these plans. So climate change, health, and migration should be integrated into the NAPs, into the NDCs, into any other relevant development strategies that nations try to apply. And in a very recent study that we actually conducted with IOM, and we presented a little bit about it yesterday, and this was in Lebanon, it was very evident that there still remains a very clear gap in integrating the human mobility dimension into climate and development policies in Lebanon. So we do have that link between maybe climate and health to a certain extent, but human mobility is very much still weak, and it could be linked to many issues, simply the whole issue of Lebanon not being signatory to the Refugee Convention, for example. So these policies really should be more inclusive. They should be people-centered. They should be gender-sensitive as well. We tend to sometimes neglect this issue of gender, which is really important and underlying in all policies. On a regional, international level as well, I think there should be much more cooperation. So even if we develop certain policies on a national level, we need to cooperate with the regions as well, because we all know that climate change does not recognize any borders. So the effects in one country will spill over to neighboring countries as well. There are many strategies, if you want, that could be adopted, but I won't get into much details there. But one important thing I'd like to say, Michaela, that we can think of all these issues related to policy, but we can't really turn the eye to the situation we have. So we are living in a situation that has, in a region, that's continually exposed and facing humanitarian, political, economic crises. And these are all amplifying the effect of climate change and straining a system that's already very fragile. So I'm speaking about Lebanon and the region as well. So in that context, if we work on strengthening regional international cooperation and having exchange of knowledge, exchange of best practices, we will really benefit our region as well. So with this solidarity, with this shared responsibility, I believe we can have more resilient health systems, we could have better sustainable resource management, and we could have more humane migration policies that would ensure a healthier future for those exposed by the climate change issue.
Thank you. Very interesting insights. And I think from the policy level, I believe is one of the biggest challenges, because the three sectors that are still in isolation, and we have also identified in the publication that she mentioned, there is really a part of the policy gaps. And then as was mentioned by Masako, so this is the moment where joining efforts we can really have, with all the expertise, ensuring, as you said, and the NCD, we have to ensure that all the elements are incorporated. In the health sector, we need to be sure that also the migration angle is in there, because there is migration and climate change, and there is health and climate change, but there is not an interconnection. And we are now, this is why I like this event and the collaboration with the AUB and all the experts, because we are pioneering something. It's already in the literature if we research. There are some interesting also analysis, but still is a vacuum that we can bridge. So thank you, and if we have time, we have a second question also for you. And I'm going to pass to the second speaker, is Dr. Kenza Komsi. She is a leading international expert in climate change, air quality, and environmental health. Currently, she is serving as Morocco's national coordinator for the UN Partnership for Action and Green Economy, PAGE. With a multidisciplinary background, Dr. Kenza includes a host, 2 PhD, and an engineering degree. She brings science and policy to drive sustainable development. She previously led the Morocco's climate change and air quality department, and contributed to global expert bodies such as WHO, the Climate and Clean Air Coalition, and the WMO, and other important international partners. Her work focuses on early warning system, health, co-benefit of climate action, and science-based policy making. So we are getting into the evidence base with you, Dr. Kenza. With your expertise and from the scientific perspective, which are really the impact of climate change on the health? Please, the floor is yours.
Thank you so much. Hello, everyone. Good morning. First of all, it's really a pleasure to be here, and I want to congratulate the organizers for organizing the event, for the choice of the topic, and thank you so much for having me. And you asked me to put my hat off of a scientist, because it seems to me that in our topic, we need to be so different hats according to the situation. But I would be happy to put my hat of a scientist and my heart of a scientist. And just I will invite you to go back a little bit 20 years ago to 2000s, when I started working on climate science. And I'm really missing these days where climate change was for us melting of the glaciers in the polar regions and the said polar bears. And then who cares about the polar regions? So we have more important things to do. But just in 20 years, the change is phenomenal. Now it is happening in your neighborhoods, in our circle of 1 meter around us. It's even within us. It's about our health. So for me, I see climate change is not just an environmental issue, but it's a villain with different masks. And just let's talk about science. And I will, okay, so let's bear the negativity as long as you ask me to talk about science. So this is how it starts. So the human being is doing its magic to the environment or to the atmosphere. And then what happens is that it seems that the planet's thermostat is broken. You know, it's kind of when you put something in the oven and you forget to put the timer, then you forget what you have put in the oven, then we don't know when you will remember, then every scenario is possible. So what is happening in the planet now is that the trend in temperature is increasing one way. Some people say that it's not the first time. There have been a time where temperature is increasing as well. But the difference in the Anthropocene now is the pace. It's increasing one way in incredible speed. And when we are talking about the increasing in temperature, or we are talking about 100.2 degrees C as a global average in comparison with the pre-industrial era. And this means that if it is a global average, this means that it will increase in some places but not in other places. But when we are talking about temperature in average, we should not forget that it is accompanied with extremes. We talk about heat waves. Some scientists and the WMO now is asking us not to talk about heat waves, but talk about extreme temperature events. So extreme temperature events are directly related to the impacts on health. They are intensifying the cardiovascular disease. And recently in Europe, in 2022, there have been 60,000 deaths because of heat waves. Not heat waves, extreme temperature events. And not only extreme temperature events, that are the extreme climate hazards. And you need to keep in head that an extreme climate hazard means extreme health risk. Floods contaminate waters. Hurricanes and cyclones destroy our houses and hospitals. Water scarcity bring malnutrition. So every extreme event is linked to health risk. Also, something else which is weird is that some creators, tiny creators, somewhere in a place in the earth, they decide just to leave their places and come discover other places. These small mosquitoes that are related to vector-borne diseases such as dengue, malaria, leishmaniasis. So these mosquitoes book their tickets and come discover our places from the tropics, because climate change is creating beautiful places for them to live, and they are bringing these diseases to us. In our region, the temperate places are the North Africa mainly, and we started to see some dengue and leishmaniasis cases in Morocco. And the cherry on the cake, because al-masa'ib la ta'ti furada, troubles are not coming individually. So there is the air pollution, which is a little bit the cherry on the cake, and air pollution likes to party with climate change. So already there have been an observation of the increasing intensity of dust storms coming from for example, in our North Africa, Sahara, they are coming from the south to invade the countries in the north, and they are bringing particulate matters to our atmosphere. And already we have our emissions that are in the atmosphere. All this is related to the impact on health. All this impacting our cardiovascular and respiratory health. And air pollution, there have been recently, according to the assessments by the WHO, there have been between 7 million and 8 million deaths annually, globally, from air pollution. In our region, it's more than 270,000 deaths. And from PM, it's between 4 million and 5 million. So it's really, so we need really to see it as a villain. It's not about one sector, one thing. It's about everything indeed. Yeah.
Thank you so much. And I admire you as you had make simple the complex science base around all the sector. You make like an history, but science is very complex behind. And then I also like the fact that you can back in the time, because we need to learn. We have the same issue also for the migration, when at the beginning, as you see from my colleague Masako, takes time to understand that people were moving also for climate change. At the beginning, but the same discussion. People is moving anyway. Is moving for economic reason, is not moving because the climate change. Now we have the evidence. So now that we have those evidence, the issue how we can bring the solution, because we cannot wait anymore, as you said. And thank you so much. I just want to add one element, especially on extreme weather event, extreme heating temperature, and with the migration angles, that sometimes people is moving for economic reasons. And in MENA we have, for instance, all the 1,000 million of migrants that are moving in the Gulf countries, working in an outdoor element. Not only cardiovascular disease, but we have now tons of evidence research on many of the migrants going back with not traditional kidney disease and failure in dialysis, to the extent that it's getting a public health issue in some of the countries like Nepal. So how the policy, for instance, in this case, policy that they try to minimize these are really effective, how we can link the policy with the evidence, helping also the countries to revise also some of the policy that, for my perspective in public health, there are still too mild comparing on what we are facing. So thank you also for the first two speakers so far. And I am pleased also to introduce the third speakers, Dr. Rula Matjalani. She is a senior climate advisor at the International Center for Agricultural Research in the dry area, CARDA, where she aligns food systems transformation with climate and sustainable development goals. Formerly director of the Arab Center for Climate Change Policy at UNESCO, she brings extensive expertise in water, energy, and food security, with a master in urban and regional planning from Syracuse University. She has supported regional policy processes and served on international boards, including the Global Water Partnership and the Stockholm International Water Awardee Committee. Thank you for joining us. We are looking forward of your thoughts. The question to you, with such an extensive experience in semi-arid region, what do you think are the most pressing challenge related to the stress or climate change in those areas? Please, Floris.
Thank you. First of all, thank you for inviting me. It's a pleasure. Temperature that is way above the global average, and that we are expecting to see. We're seeing it gradually, but also in extreme events, as it was mentioned and emphasized. It's getting worse every time. It's getting with longer frequencies. This is what we forget. We used to have what we call khamsiniyat, the high temperature sporadic. Now we have them consecutive years, and now we have them affecting, as it was said, the health. I will get to that later on, but also in prolonged ways, and affecting also the whole weather system. We have reduced rainfalls, but we also have about like 20% on the average in regions. But we also have shifting rainfalls, and we have the type of rain that is that is reducing. And with that, you combine it with rising temperature. Our groundwater is getting reduced, because we have natural aquifers that are getting reduced. The water is getting reduced. So we have the problem of water stresses. We have the problem of food insecurity, land degradation, desertification, and of course socioeconomic problems, and the incapacity, as Yara mentioned, to mention these crises. But let me just reiterate a point that is close to my heart. The stressors for movement within the countries and across borders are wars, conflict, and occupation. And these we need, and because we have a community of researchers who are looking into this, it is very important not to see this as a direct cause-effect relationship, but it is something that takes time in happening. With climate, I mean with the climate push, with the change in temperature, with the floods, with the extreme events, people move in at a slow pace. They start by having the men moving to the city to find a job. Because you have a reduced in food production, you have a reduced in the crop production, in the quality of the food, and increased prices. You need to buy more to get more, spend more on water. You need to spend more on getting the energy. So it is with reduced with high socioeconomic stresses. And combined with the climate, people move in a first step to the city, within the border. People move across border, pushed by a conflict, but also when you ask them, and we've done many surveys within ESQA, with the MEDEC, people move because they want a better opportunity for their kids, they want better health services, they want better education. Of course, climate is related to that, but I think that in terms of the research, you see a lot of sweeping generalization that you have. Especially we speak about the nexus, and the nexus exists. I'm not underestimating the nexus. It does exist, but one needs to see at what pace it happens. One needs to see how you have the capacity to manage these crises. We talk about heat waves and heat stresses, and people dying of heat stresses. In Saudi Arabia, in Kuwait, in Iraq, they've had registered heat temperature of exceeding 50 degrees. What is happening is that you have, in countries that are rich and can afford it, they can use more air conditioning, more, and it's not maybe, it's for sure not a sustainable solution. But that to say the difference, and I think Dr. Noor was mentioning the importance of looking at social justice in that respect. When you deal, climate change affects societies differently and affects groups differently. And this is where the linkages that is important to look into. In that sense. I think that also institutionally, to what extent do we have that capacity to manage crisis? You have extreme events. You've had the floods in Libya. You've had the breakdown of the dam in Sudan. It produced. This is where you see mass movement. It is with extreme events, and you have people getting displaced, but equally getting people displaced because of the war, because of the conflict. The other thing that, and here it's a kind of a warning sign to people who do collect the data and collect the information and say, oh, we've had the number of migrants that have moved from the MENA region. I don't like the word MENA region. I prefer the Arab region in that sense. You have 20,000 in 2020. I have you have 30,000 in 2021. One needs to also look at where these people are originating from. They're originating from the Middle East, from conflict areas, from Syria, from Iraq, definitely, from Lebanon, from the MENA rim, the Mediterranean rim, but also are originating from the tip of southern Africa and from as far back as Afghanistan. And one needs to track how these people find the possibility within the MENA, that capacity to bring illegal migrants to the shores of Europe and send them there. So when we speak, and here another point that relates to the importance of data, we need to disaggregate in time, in groups, and how it happens over time, and what is the tipping point that happens where socially, but also governance-wise, institutionally, the capacity to manage these processes are happening. Countries like Lebanon, like Jordan, like have a capacity, yani a certain capacity to cater for displaced and for refugees. One needs to understand also that. To what extent, if yani a country that has 50% of its population are migrants, and there is no capacity, in countries, for example, of the Gulf, you have 10% who are nationals, but they can manage. So that dimension, the socio-economic, I'm not making any political statement, I'm just saying that dimension is really a very important factor in any analysis that we undertake. Now, of course, there are technical solutions, there are or technical ways to deal with, and sorry, before I speak about this, let me just highlight how this is impacting agriculture, the agriculture sector, and from there the food security, and that brings us also to the nexus with the health and its impact on nutrition, on the higher incidence of malnutrition, the higher incidence of stunting, the higher incidence of people who don't have the food and diet variety because of climate change. These are very important in that sense. And I don't want to undermine the linkage with the climate. I just want to say that there are steps that influence and that impact the scale. So you, the loss of biodiversity, the loss of the crop variety, the livestock, and in arid region they rely on livestock. I know that sometimes you hear about like we have to stop with meat and stop with but this is a region that needs its livestock, because in desert areas, in arid areas, you need to maintain that, and they are it's not just humans who are undernourished, but our livestock also get affected by these and by these factors of climate stresses in that sense. Added to that desertification, added to that changing landscape, land use, patterns, and cutting out, burning trees, cutting out trees. There is definitely a climate element, but there is a human element not to be underestimated in that sense. So, shall I leave for later, like what are these possible solutions?
So
I'll stop at that. Thank you.
But thank you so much. And also you touch some of the, I would say, sensitive also element. We could not agree more than what you said, in the sense definitely climate change, as we said also, and we found written in many texts, is the threat multipliers. So it's not the main reason to move, and this is why it's also difficult to understand why people is moving. In certain countries, certain region, of course, you have more movement because of conflict, or maybe employment reason as well. In other reasons, sometimes, especially in the rural area, maybe climate change can be one of the top priority because of water scarcity, etc. So linked to economic, because at the end, when we are talking about the movement, as you said, everybody's moving for a better life. That's the basic, simple. What it is, the better life, it's on the personal base, but it's for the children, etc. And this is why it's also important to understand that the mobility, human mobility, is very complex scenario, as you mentioned. You already mentioned the data now we call it MENA, North Africa, Middle East, for practical reason. We have reached 40 million of migrants. And then we have the displacement. So there is also a big difference between migrants and the refugees because of legal protection and etc. Migrants, they move mainly for economic reason, and mainly they move regularly. This is something, right? But even when they move regularly, as I said, they may move in an area highly exposed to climate change they don't know, and maybe the policy again are in place not to protect them. So then there is a movement of regular migrants, right? Especially we have the North African countries that they are becoming receiving countries from sub-Saharan Africa. Situation is really deteriorating day by day.
And as IOM, we are really receiving an increasing number of migrants with health problems. And some are related to the condition of the journey, etc. And this is an important trend. And only Tunisia, for instance, 10,000 consultations last year, and only now in June, half of the day, we have reached 7,000 consultations, so it's increasing exponentially. Irregular migration is one element, regular migration is another, so I totally agree with you that we need also to differentiate and disaggregate the data. Many countries, they have a clear understanding who are in their own countries, like the Gulf, they clearly have disaggregation nationality, and other countries, from the Ministry of Interior, they have the data, and here another gap. The health systems does not disaggregate the data, right? So the only data we can have is from projects, and this is something we can maybe reflect and advocate together to have this data disaggregation. Thank you for the inspiring. So allowed me to introduce the fourth speaker, which she is online. Dr. Lucia, can you hear us? Yeah, I can see you.
Yes, I see you and I hear you.
Excellent. Dr. Lucia Barcellini, she is a pediatrician with a Master of Public Health. She has held research roles in academia, including at the WHO Collaborative Center for Tuberculosis Surveillance in Milan, where she led her own independent work on TB screening about migrants. Previously, she collaborated on vaccine preventable disease and antimicrobial resistance. She also worked with Médecins Sans Frontières in the Central African Republic, addressing child health in humanitarian setting and working like a clinical pediatrician. Currently, she is serving as a technical officer for migration and health at the WHO Regional Office for Eastern Mediterranean region. Her current work focuses on strengthening health systems for refugees and migrants, with an emphasis on evidence-based policy and equitable access to care. Thank you, Lucia, and sorry you cannot be with us. It's a very interactive, and the room has lots of participants ready to hear your contribution. We have a question for you, Lucia. So migrants and refugees and internal displaced persons, we have also previously discussed, they always live in high-risk environment. So how WHO is working with the government to ensure that those populations have the right access to the services, and what do they need it? Dr. Lucia, the floor is yours.
Thank you, Dr. Michela, for the kind presentation, and thank you to the organizer for the opportunity to speak about WHO work in this area. And I really apologize for not being here. I think that we need to have another time and redo some events like this one so I can join in person. And I'm really honored to be part of this panel, and all the interventions so far has been so thoughtful and insightful for me as well. And to address your question, Michela, I will try to explain how WHO, and in particular my unit, which is based in health system strengthening, which is on migration and health, but based in health system strengthening, is working to assure that refugees and migrants has a right place in health system of member state in the Eastern Mediterranean region. You already said, and we all know that the Eastern Mediterranean region hosts a huge share of migrants, refugees, and displaced population, probably the highest among other WHO regions. And that's why it's so important that this huge share of migrant is not forgotten, but is part of the population that health system serves. So as WHO, we develop a strategy on health and well-being for refugees, migrant, and displaced population. And this strategy is, has been finalized in 2002 after broad consultation with member states, and its goal is quite simple, but to be fair, quite ambitious as well, is to improve the population health by ensuring that the displaced population and migrants are fully included in the national health system of member states. So not treated as separate, optional, but they are part of the whole. The strategy is built around 4 core objectives that are the 4 pillars of our strategies, and the first pillar is inclusion. Inclusion is a key word, but in this pillar we try to operationalize what inclusion means for migrant in health system. And it means that migrant, refugees and displaced population are part of national health strategies, of national health preparedness plan, and as you mentioned before, and I'm glad you did, are part of national information system. We know that health information system is one of the 6 building blocks of health system, as long as system as a service delivery. So is a fundamental part of the health system. And as you mentioned before, too often migrants are not counted, and being not counted, they are not visible. And this makes very difficult to plan and advocate for their needs. So when we talk about inclusion in an operational way, we want them to be part not only of national health policy and strategies, but also be visible in terms of health data, health outcomes, but also access to care. The second pillar of our strategies is responding to emergency and assure that during a crisis that unfortunately are affecting the region, we must ensure that migrant and displaced population are not left behind and can access to essential service throughout the process. The third objective of our strategy is focuses on social determinant of health. And in this regard, we recognize that migration is just one of the vulnerabilities that people can that people face, that can make them prone to worst health outcome. But it's not just migration. There are several other social determinants of health that take part of this process, like housing, employment, education, legal access, access to information, and all of these contribute importantly to the health outcome of migrant as well to the health outcome of host community. And among these social determinants, we must recognize now, and as you mentioned, we are pioneering this field, that there is also environmental determinant of health, and in that there is climate change. That is another layer of vulnerabilities that can affect migrant and host community, and must be addressed to improve health outcomes. And the fourth pillar that is the last, but not the less important, is partnership. And you know, Michela, that we as WHO and IOM, we are partner in many projects and in many projects in the region, because there is no single actor and no single sector that can achieve this ambitious goal alone, to try to integrate migrant and displaced population in a health system. We need a whole government, a whole society approach, and we need to have partners that can work in their respective field and collaborate to reach this ambitious goal. And the strategies also, of course, acknowledge the fact that among member states we have a different legal system and different capacity. But what matters is ensuring that access to care is based on the need and not on the status. And right now, we are supporting countries to put these strategies in action, helping integrating migrants in the national health plan, in the national information system, and also in the emergency preparedness plan and action. So this is our strategies we are very proud of. It's not just a framework, but is actually a plan for action for us to follow in the next year.
Thank you, Dr. Lucia. And you know, WHO is the core agency for health. Really, we count on WHO and the strong commitment, especially for the implementation of the strategies. We discussed before how we can translate the framework strategies into concrete action. And from IOM, we really appreciated the collaboration with WHO. As you said, we have a concrete project also on pipeline to put in practical the policy level. And another important element of the WHO work is also actually the new indicator that the WHO also at the global level and the regional level has introduced on the new global work plan at 14. There are two new indicators. That's one is measuring the access to health services for the migrants. And this is also important. We discussed before, Dr. Lucia also, the gap in terms of data. The health systems is not disaggregating data at the moment. So how also we can strongly and even more aggressively, I would say, advocate to introduce migration variable in the health systems management. It will help all of us also to have it clear. Thank you for your contribution, and next time we really hope to have you in presence. And I think now the time for our preliminary discussion is getting a bit tight. I would like to open for questions because it's such a privilege to have estimate expert, and I can see already. Please introduce yourself and then pose the question. Thank you.
My name is Mirna Doumet. I'm a nursing faculty and I'm the co-director for the climate change at Global Health Institute. Thank you very much for this eye-opener discussion and presentation. And while you were talking, maybe you noticed me taking notes because I have several questions, and I liked the idea IOM presented about the to move, that you follow up on the to move and to stay. But the question here, what about the host population and the system, the stress on the system? And I mean by this, the stress on the school, the stress on the sewage, the stress on the electricity, the stress on the increase in cost of nutrition, of clothes, of going to restaurants for the hosting community. And this creates really friction between the host community and the refugee. And this also is a vicious cycle because this might create another migration of host community internally or outside the country. And also this might affect the economic situation of the country. Okay? So what are we doing in terms of strategic and operational plans really to overcome all this? And what are our mitigation plans? Because really climate change is not simply melting of the North Pole. It's more than this. It's a high impact on the healthcare system, on the school system. But the healthcare system, I believe it's the base, because if you don't have health, you don't have schools, you don't have economy, you don't have work. And if we have stress on the healthcare system, I mean also on the nurses, on the physicians. They will stop working on the infrastructure, medication, equipment, and etc. Thank you very much.
I will collect other questions and then we start replying. Please, the floor is.
Good morning. It's Farah Salahab. I am gender expert and strategist, and also I worked a lot in the field. And basically, this is where I'll draw my question. I mean, my question will be drawn from my experience in the field and on the ground. We mention a lot that nothing about people without people, and they should be involved in everything that we do. So when there was a presentation on the daily workers in the Gulf, so we noticed that, okay, it's really good that there are discussions ongoing about marginalized peoples whose voices probably aren't always heard. But speaking again of the policy making and how, the efforts that we've been trying so hard to push about making people also policy makers, do we have any recent examples, any learning on the involvement of those who were affected the most and how they managed not to only influence but also to be active agents in the policy making? So basically this also draws from the discussion on policy making and how you try to bridge and make people marginalized voices heard more. Thank you.
Thank you. This is a question for you. We have the third question also.
Thank you so much. My name is Mahmoud Khadur. I'm a physician with a master in public health, interested in climate change and problems going on in Lebanon. First of all, thank you so much for this framework and networking to highlight navigating the climate change and immigration. My question is that for the IOM, considering your central role in supporting health system, are there ongoing offers to revise the national primary health care packages to address environmental health, health-related, and the access for displaced people in Lebanon? So, thank you.
Thank you for your question. There is another one, and then we can go on the first round for the answer. Yes, over there.
Thank you. I'm Azza Adra. I'm a program director of Akaruna organization. We operate in the north and the Akkar governorate. I tried a little bit to envision what you were saying, respectful ladies, and I thought that we are going to an extreme disaster. So we have to start from the strategy of the DRR, I think, and where we stand now, where are we going in the future, and then I'll ask you the questions. So since it's a one-way temperature increase and no going back, I think we will see a lot of extreme temperature events, as you said, which are the heat waves. We can see that we will have an extreme increase in health risks within the community itself. We will expose a lot of gender sensitivity, violence, domestic violence, and so on. We will see the droughts are coming, and we will have a food insecurity issues within all the communities. I'm talking about Lebanon and the national level and how the stakeholders should be working and compiled efforts should be all put together. The food insecurities, the SRH risks, as Doctor has been saying, so we will have a lot of family planning, SRH risks, and a lot of things that will be exposed within our community. So I have one question to all of you ladies, please. Where do you see the role of the NGOs in this crisis on 3 levels? On the policy making, where we are maybe the main actors that will bring you the actual contexts of the communities in Lebanon. Where do you see our role in the advocacy, where we are also the main actors that spread awareness, give knowledge, transformation of many things to the communities themselves, who make the actual change, whether in global warming or in reducing the risks of global warming? And where do we see, do you see the NGOs or the role of them within the lobbying, where we have to prioritize the global warming and the climate change to be the main issue on the table? So thank you so much. These are my questions.
Thank you. And I will allow the panelists to answer, and then we will leave for the IOM to answer. Dr. Lucia, if you have any inputs, please let us know. Even if you are online, you are with us for the answer.
Sure.
So I think the question on the policy is, Dr. That's for you.
Thank you for that question, because I was actually looking forward to tackling the gaps in our second question. We didn't have time for that. So one of the key things we try to promote at the Institute is to move away from that top-down approach to a more inclusive one. So we know that those affected, those vulnerable communities, in whatever topic we're tackling, regardless if it's just climate change or migration or health, they're the ones who have the lived experiences. They're the ones who are the knowledge producers. They're the ones that should be included from the start. And this is what we try, and I'm sure a lot of other institutions in AUB are following the same approach in including them in this whole thinking and this whole planning. I could give you a success example if you want. That's not necessarily on this topic, but just as an example. So we worked on the issue of birth registration for Syrian refugees in Lebanon, which was a horrible situation in the past. Still not the best, but a little bit of improvement was there. What we did is that we involved them with us through organizations that work directly with the refugees in negotiations, in meetings, closed meetings, yes, just to avoid any backlash on them, with the Ministry of Interior, with UNRWA for the Palestinians, with UNHCR. And we actually were successful in getting from them what are the real barriers they're facing. Now, the barriers is not the process. The process is very clear. But it's where you have the Mukhtar or this ex-official adding sort of extra requirements for them in a certain stage in the registration. And it was actually successful to a certain extent. I know they released certain circulars to the Makhatir, to the municipalities to ease the process. We did see, it was very small, but we did see the number of registration increasing slowly. So I think another thing that we actually do, and this is to answer your question as well on NGOs, is we work a lot through networks. So networks that include civil society organization, NGOs who are on the ground. A lot of them are Syrian-led when it's related to Syrian refugees, for example. And this is how we also include them in our work and in disseminating our work. So lots of times these NGOs are our representatives in certain conferences, like the Brussels conference or other conferences. So I think for us, CSOs and NGOs are our key partners in any work we do. And anyways, in any policy making, I think it's no longer an elite, if you want, level thing. It should include all the stakeholders included in the process. I hope I answered your questions.
Yes, I just want to quickly add one thing on the funding and the role of the NGOs. I would say, like, we have moved a little bit away from the donor influencing our work, and we are starting to influence the donors.
Absolutely.
So I think the more research, the more evidence-based
Absolutely.
data we have, the more we can influence the donor and shift that narrative on.
And donors have gotten more used to including us from the start. So another point I also wanted to say is that there's a scarcity of southern-based research, right? And a lot of research is done in the north, on the south, and this is changing with time and it's changing more. And donors are seeing that and coming to us more often for localized knowledge production.
Yes. Thank you. I want us to take the question related to the NGOs, and I like the way you asked your question, because what you've done, just you listened to what we have shared, you summarized it beautifully, and then you said, what can we do? And I would say, what you have done, learning the evidence and looking for action, this is the role of NGOs. And then you asked from policy, advocacy, and lobbying perspective. And here I really want to stop with policy. And I think we need to understand how policy is really created and when the change happens. So usually scientists always creating troubles because they are bringing evidences. But then we are always nagging because we want the change for the policymakers. And the change happens when we have this agreement that the change should happen. And the agreements happen through the policy window. And the policy window is this intersection between the policy stream, the politics stream, and the problem stream. And what I see, or where I see the role of the NGOs is to know where we have this cross-cutting between three of them. And this happens when we have the crisis. And I think even though we are talking a lot about climate change, we still don't see it as a crisis. And it needs intervention now and at the moment, here and now. And I think the NGOs should emphasize this. Through one example where I have seen the intervention of the civil society very strong is the PAGE. So the Partnership for Action on Green Economy is bringing the civil society to the table. And the idea is that you need to be ready to sit around the table, starting from the evidence to what you really want, and raise awareness through your society. Because we still have a problem with awareness. And this is what is stopping us from seeing it as a crisis. So I think the NGOs need really to highlight it as a crisis, because policymakers are aware that there is a problem there, but is it prioritized? It's your task to make them feel that it is prioritized. And then making this feeling of this crisis is sustainable, this is advocacy, you see? And then you talked about lobbying. I don't believe that all our NGOs are working together to create lobbies in our region, not at the national level even. And it's the same thing in all countries. So I think this is the thing. Think from a policy window when it is really felt as a crisis.
Thank you.
Responsive to, but not the climate change thing. Yeah. So thank you for, maybe we need to make it as a strategy for all the stakeholders to work together, because I think it's a collective responsibility for everyone to make it the top topic within the community. Thanks.
So thank you so much, Azza, for this question. And I just wanted to highlight that the next panel will be all focused about civil society and community, and we will have and we have local organizations, international agencies, and agencies as well. But Kamen, something to add to what my colleagues here said is that one of the roles that we should play is to actually build the capacity of NGOs to start creating climate-sensitive health programming, right? And how to integrate climate change in their different programs and their different proposals. And another role that we should play, and I'm wearing here the hat of the NGO initiative, is to start sensitizing the donors about the importance of climate change and how it affects, the different communities that the civil society actors serve in the region.
This is why I think we are here, merging academia, expert, UN agencies, civil society. Thank you, IOB, to have created this really heterogeneous platform. Also as IOM, for us, the working with civil society and NGOs is a foundation. So the projects are implemented wherever there is the capacity with the local NGOs. So we don't step into the role, and we do the training, but also we believe in the empowerment of the NGO. Talking about what was mentioned at the regional level, indeed, it would be really visionary to have a regional network. Some of the countries they have done, there is a network also for MENA, for harm reduction. MENA, I think you are aware. But other networks, they may be difficult, because not all the countries, they have the same presence of the NGOs, and the NGOs, they have the same power. Lebanon, I think, is one of the pioneers in this regard. So looking at the regional level, and this depends on the topics that we are addressing, having regional network would be really needed, but also complicated at the same time. This is something maybe with AUB and with other also WHO we can discuss together how and which is the thematic area that can bring the NGOs together, serving the different priority. I just want to add something on that for IOM, and then I will leave you to add. There are two questions also. The topic that you raise, it's the reality. It's not science fiction, and was mentioned also here. Lebanon is a unique observatory. I lived here 10 years ago. And then I have been here on and off always. I saw the difference. So I know what they are feeling, what they are talking, and definitely is under the eyes of everybody. And it's known also. And this is why you have also a special attention also for donor. We need also to see the other perspective, right? And even when I left 10 years ago, Lebanon didn't have the same attention from donor, and then because of the crisis, etc. And has created some opportunities also for Lebanese, etc. This is out of, we would say, for our control. The approach we do for IOM, and this is undiscussable, we work for all. So when we go in the community and we do with the angles of migrants, we do strengthening for all. And there are many examples also in other countries where, for instance, we start a clinic for migrants on tuberculosis because the country was not able to treat them. Then the clinics become primary health care. And then they start accommodating also local community because we serve everybody from the public perspective. Lebanon, I would say it's indeed a challenging country for the situation because it's complex and different layers. From IOM, the perspective we have to work on the community level, independently who is there. So is our mandate maybe to work in the area where there is a higher presence of migrants because it's our mandate, but also from the experience, and we have colleagues from the country office can provide you more details. We serve all, and we all agree with this. We work on health system strengthening. We are currently supporting through the Global Fund, National TB Program, HIV Program for all. Even if the entry point was emergency Global Fund for the migrants and refugees, but we serve for all, the health system strengthening is for all, training, etc. We do believe in this one because it's a reality that creates conflict, it creates burden, and Lebanon has shown the history in these years. So thank you for the question because also for us it's something sensitive. In terms of health sector, as the question you said, yesterday, for instance, we had the meetings and that actually was an event presenting some more research of climate change on the health systems and also on the community, led also by the Ministry of Health and Environment. There is attention to this. Also in the, we would say in the Ministries of Health, priority are also many. So the climate change is also on top, equal to many other, as you know, of the health services. But they are working on also, and there is a strong commitment also from the minister. And as we said, climate change is really a threat multiplier. Sometimes it's taken as a priority, it depends on the lens, as you said. Some other times, if you look at other perspectives, it's not taken as a priority. And this is why we are here together with the science and evidence base, the experience from the field. The NGOs, for instance, are extremely important to bring fact from the field and to influence. And then together we can influence the donor. This is what I also noticed. I confirm with you more and more donors that are coming to us, not for the project, but to know the situation, the trend. So this platform is an opportunity to be strong in our voice, harmonize, unified, to create a coherence of the message we want to give it, to inform the donors, and from top down, from the NGO work, from the policy level. My colleague to
response for the IOM.
Yeah, I'm conscious of the time, so I would probably just compliment what my colleague Michaela said. And thank you so much for raising a very pertinent point. And indeed, our approach is to serve everyone. But because we have a mandate to focus on migrants and mobile population, yes, we tend to work in an area where the migrants are concentrated or displacement populations are staying. But we do have actually this conflict sensitivity approach. The intervention that we actually do, we actually analyze what might be the potential risks that might generate conflict. So we would make sure that when we actually do the intervention, we serve both the host communities and mobile populations as well. I can give one quick example from Yemen. Because Yemen, due to the war, the IDP, as Ms. Laura mentioned, there was influx of the IDPs in a particular area, which created a conflict with host communities because of access to water. The Yemen is also suffering from the high water stress. So what we did as an intervention was when we actually work with the community, both host community and IDP community, to increase the access to the water, we also combined with a conflict resolution mechanism set up at the community level. In fact, actually, women played a key role because they are the ones who also often use water for household, but also agriculture as well. So that's actually a mechanism brought both the host community members and IDP community coming together and discussing the resolution. How we can make sure the inclusive access to water, because water, scarcity affects everyone, regardless of the local communities or the IDP communities. But we are actually aware, and whenever we do this approach that I presented, we are always conscious that it's affect everyone, climate change affects everyone, and how we can make sure that our intervention do not create any new conflict. Yeah. So thank you so much for the question. Very quickly about the question of how we actually getting voice of the migrants, IDPs, to the international climate discussions. IOM, in the last 3 years, we've been supporting the migrants, IDPs coming to the COPs. Of course, we cannot bring the large number of the, people, but we actually had, for instance, a representative from Libya who was affected by the Deruna, the storm Daniel, and came to the COP29 last year to present his experience of how he actually worked with displacement, aftermath of the flooding to support the displaced population, and why the IDP's voice have to be heard in the international, discussion, so that their concerns are reflected in the policy. I'm also aware of the good practices of how the governments are also trying to get the voice of migrants, refugees, and IDPs, reflecting in their NAP and NDC as well. For instance, currently Tunisia is working on NDC 3.0, and they've been actually organizing the community consultations to get the voices from community reflected in NDC. For NAP, for Iraq, we supported the Iraqi government to develop a human mobility chapter for the NAP. And we also did a number of consultations with the communities, especially in the marsh areas, which are affected heavily by the climate change and their traditional livelihood being affected. So we actually also got their voices reflected in a chapter so that it can be a part of the national policy as well. So thank you so much. Back to you.
Thank you, Masako. And our time is finished. And thank you so much for the inspiring conversation also to the participant. And I will leave the floor to the Master of Ceremony. Thank you.
Thank you for this panel. It's time for a short coffee break. Please feel free to step out and let's get back in 10 minutes at 12:20. Last but not least, it's time for our second panel discussion, Localizing the Climate Health Migration Nexus, Community, Civil Society, and Humanitarian Action in Practice. We're pleased to welcome Ms. Noor Al-Arnaout as the moderator for this session. And our speakers and experts for this panel are Ms. Noura Ashar, Chief UNDRR Regional Office for Arab States in Egypt, Ms. Abir Abu Zaki, Youth and Adolescents Development Specialist, UNICEF Lebanon Country Office, Mr. Qasim Sha'lan, Director, Disaster Risk Reduction Unit from the Lebanese Red Cross in Lebanon, Ms. Pamela Di Camillo, Head of Programs, UNFPA Lebanon, and Mr. Fadi Dway, joining online. He's the Climate Resilience Technical Advisor in Save the Children International Egypt Country Office.
So in this panel, we will be focusing more on the community, civil society actors, and the humanitarian practice. It's actually focused about localizing the climate health migration nexus, community, civil society, and humanitarian action and practice. We have with us an esteemed pool of panelists spanning across UN agencies, international agencies, and local organizations as well. We tried to reduce the number of panelists, but we wanted to cover everyone, so it's a bit of a large panel. So to start the discussion, without any further delay, we're going to start with Ms. Pamela Di Camillo. Ms. Pamela Di Camillo currently serves as the UNFPA coordinator in Lebanon. With 15 years of experience in various management roles, Ms. Di Camillo has collaborated with diverse organizations encompassing NGOs, international organizations, and the United Nations. She worked in different complex settings, including Palestine, Jordan, Myanmar, Turkey, cross-border operations in northwest Syria and Tanzania. She joined UNFPA in 2018 with UNFPA's regional operations. She has held pivotal positions such as GBV specialist, GBV coordinator, and program coordinator, where she provided program leadership, strategic guidance, oversight, and played a crucial integrity role. Ms. Di Camillo is a staunch advocate for women's rights and the incorporation of International Conference for Population and Development Agenda into national policies and strategies. She firmly believes in the power of collaboration and partnership. Educated as a development economist, Pamela holds a Master of Arts degree in Development Studies from the University of Rome, La Sapienza. So welcome, Pamela. In panel one, we shed the light on the disproportionate impact of climate change on health. And we also highlighted this in our presentations. So can you tell us more about what evidence exists on how climate change affects specifically sexual, reproductive, maternal health among displaced women and girls? And how UNFPA is addressing the gender dimension of climate change and displacement in the region.
Thank you so much, Noor, for having me today. And thank you to IOM and AUB for organizing this conference. And I'm happy to be with this big but diverse panel with some colleagues. And I think it's important that you started the panel also shedding the lights on women's rights, because also, you know, it's important to talk about the effect of climate change and displacement. We cannot do it without looking at also the impact on women and the gender dimension of it. So thank you for starting with this question. And as UNFPA, we collected evidence around the impact on 5 different factors about the impact of climate change on displacement and on gender. The first one I wanted to talk about is the loss of access to essential sexual reproductive health services. When there is a climate-induced emergency, what we see across the region is that there is a disruption of services. And the women lose access to antenatal care, safe delivery, and also access to family planning. Not only the fact that infrastructure, hospitals, so primary healthcare centers where they go, they close, is that also that the women are displaced. So very often displaced in overcrowded shelter where they don't have privacy, but also they share bathroom with so many people, and this affects their menstrual hygiene. I want to bring an example shared by colleagues from our Yemen office from the flood in 2022. There were thousands of pregnant women in displaced camps, and the team recorded a sharp rise in complications such as miscarriages and postpartum hemorrhage. And this was due to the lack of transport to reach clinics. So one of the strategies of UNFPA in this kind of displacement, due to the climate, due to conflict, due to many factors, it's also to approach the services with mobile units that go where women are, and so bringing the service to them. And another second factor of impact is the increase in gender-based violence. We have violence against women as in all society, unfortunately, and in the Arab region. But when there is a displacement, there is an increase of risks. We see the impact on child marriage, for example. We see the family lost access of their livelihood, but also there are more risks or more concerns about the protection of the girls, so families might decide to marry girls at a younger age. And we see for any kind of displacement this is happening. So this is another impact. The third impact is also when we look at food and water, and I'm sure that colleagues will also highlight this aspect. We see malnutrition in pregnant women, but also scarce access to water. This has an impact on the hygiene. And I want to bring an example that is very close to my heart, I'm sure to the heart of many of you in the room. Last year, when there was this mass displacement in Lebanon because of the war, we had, through our local partners, NGOs, gynecologists who were in some of the IDP collective shelter. And I was in one in Beirut, outside a little bit of the skirt of Beirut. And the gynecologist was telling me, out of the 20 women I visited today, all of them had urinary tract infection. And this was because of using one toilet, and they were saying, and then the women didn't want to go to the toilet, and this also increased the risk of UTI. So this is also looking at water scarcity and the connection. And then other two impacts I wanted to talk about, it's the psychosocial stress and the breakdown of protection system. We saw that also brings women not to prioritizing their needs. They look also at, they don't prioritize their needs, they don't seek help, but they also might not access family planning and antenatal care and postnatal care visit. We have evidence of this in many contexts, including Sudan, for example. And displaced women, we know they often lack documentation. So in some contexts also, if you don't have documents, you might not have access to service. So they might lose the opportunity to access reproductive health services that they need. And I think I just touch upon a little bit what we do as UNFPA. I mentioned the mobile unit, but not only, and we work very closely with women-led organizations, there are a couple in the room, with NGOs, community-based organizations, to bring really the services to the women through mobile units, but also, and I connect back to the policy strengthening, really advocating for universal health coverage, really advocating for prioritization of sexual and reproductive health and gender-based violence in each emergency, in each displacement. And we distribute dignity kits. We talk about the challenges on menstrual hygiene, and women are running with the families. They are displaced. They might not prioritize bringing with them their sanitary pads. So it's always very important to provide dignity kits. But dignity kits is also an entry point for psychosocial support. We have trained staff who gives the kit and is trained to provide psychosocial support and support to the women, and also handing over numbers of hotlines if the women are survivors of violence and they want to maybe chat with someone about what happened to them and see which are different paths to recovery and resilience.
Thank you, Pamela. In fact, in a recent study that I read, they used a chatbot to provide health information about sexual, reproductive, and maternal health. And they did this intervention in two areas, one that is subject to extreme weathers, and another that is not really subject to that. And they noticed that women in these, areas where there's extreme heat waves and so on, they were asking more questions about their babies having high fever, having diarrhea, them having UTI, and so on. While other women, they were more concerned about routine questions such as when to vaccinate their children, what time to visit their health provider, and so on. So there is actually an impact of climate change on the lives of women and their babies, especially those in vulnerable communities. Thank you for your input, Pamela. So now we're going to move to Ms. Noura Ashar. Ms. Noura currently serves as the Chief of the United Nations Office for Disaster Risk Reduction, UNDRR Regional Office for Arab States. With over 20 years of experience in program and project management, Noura has led humanitarian and emergency operations and coordinated cooperation programs across the Middle East, Africa, America, and the Asia-Pacific region, working extensively with international organizations and the private and public sectors. Throughout her career, Noura has made significant contributions to disaster risk reduction activities. She has led initiatives in community-based risk reduction, early warning system development, and explosive ordnance risk education and prevention. She has coordinated numerous working groups and played a key role in capacity building activities aimed at civil society organizations, national institutions, and entities. Noura holds a BA in social work from St. Joseph University in Beirut and a master's degree in public health with a focus on environmental policy from the University of London. Thank you so much for joining us today, Noura. UNDRR is a key player in this whole discussion about climate change, health, and also migration. And we wanted to ask you about how is UNDRR working with local governments and the Arab states to translate the climate, health, migration communications into localized disaster risk reduction strategies? And do you perceive that local governments have the necessary capacities to do this shift?
So much, Noor, for hosting me, for AUB, for IOM also to be part of our colleagues and partners who are working within in the Arab region. And thank you for your question. First, you mentioned in your introductory presentation about the Sendai framework and disaster risk reduction and the link to climate change and health. And UNDRR being the custodian for the Sendai framework, we do recognize this intersection between the three components. And we do support the local governments through a multi-sectorial approach in four main areas. The first area is about integrated risk assessments. So we do support local governments. And when I say local governments, it's not only the municipalities and the ministries, but it's also CSOs, NGOs, stakeholder groups. We do work with them to develop risk assessment, multi-sectorial risk assessments that include climate change, health, and mobility, human mobility, in order to help them develop disaster risk reduction strategies and action plans that are multi-sectorial, that look into the different aspects of their weaknesses and their needs in terms of risk, and try to come up with plans that are responsive and are based on the capacities. Those plans help them also identify where the gaps are and how they will be working into making those gaps and working on those gaps to make them a reality. We do work with the most stakeholder groups, and I'll touch base on it on the second part. In addition to integrated risk assessments, we do help in capacity building. We have a tool that is called the scorecards tool, and this is part of our Making Cities Resilient 2030. So we do work with cities and local governments to develop scorecards where they will evaluate what the risks are, what they have as capacities, and what are their needs. And through the Making Cities Resilient, we work with those cities to come up with activities to be prepared, to prevent when they can, to reduce, but also to respond in terms of disasters, including climate change. Those plans are inclusive, so women, youth, media, academia, scientists are included in addition to the local governments. We also work on the stakeholder engagement, and when we say stakeholders, we say the 7 stakeholder groups that we have and other, including minorities, vulnerable groups, youth, women, media, academia, the Red Cross and the Red Crescent Society, and other groups that are important to be and that are included since the beginning in the discussions about what are the needs, what are the risks, but also about their comments on what they know on the reality, because we want their voices to be the drivers of the plans, of the local plans that are made, tailored, and specifically done for the cities and the local governments we are working with. we also bring them together. So for example, in Jordan, we made sure that we brought together, we were the bridge between the local governments, the CSOs, and the communities in order to come up with a plan based on the reality. It was in Irbid where we had the women group come and discuss things. It was the first time the women groups were included in those discussions. And they brought forward, since the get-go, some of their observations to make those plans more applicable to the situation itself. In addition to that, we do work on regional knowledge sharing and partnerships. UNDRR, in collaboration with the League of Arab States and the 22 member states of the Arab region, we do develop every 2 years what we call the Regional Arab Platform for Disaster Risk Reduction. And we bring together all the different stakeholders and actors in disaster risk reduction in the region and globally. And this year it was in Kuwait in February 2024. And we had 2 thematics on disaster risk reduction at the local level. One was an urban lab where we brought together cities who shared their experiences on local planning and disaster risk reduction. And the other was a panel discussion on the needs in the region. Also in the context of the Making Cities Resilient 2030, we do develop the local plans with different cities, and for the ones who are developed and who have reached a certain level, they become the hubs and they share their knowledge with the other cities. We so far have 2 hubs. One is in Dubai and the other one is Sharm el-Sheikh, who will be now working with other cities to develop their own plans. Voilà.
Thank you, Noura. Just a very quick follow-up question. There is an observation that there are many national DRR strategies and frameworks that do not integrate health as a major component in it. Some of them don't even mention it.
Yes.
So are there any plans to integrate health in these strategies, and how are you moving forward with that?
That's true. A lot of the DRR strategies were not climate change inclusive or climate adaptation inclusive nor health inclusive. What we are working with the different member states now is to look back into those strategies and work with them to make them more inclusive and to make them more adaptive. So we are in the process of assessing where we are from the plans, who is actually working on those plans, which ones need updating, and try to give them the technical support from our end to make them more responsive.
Thank you, Noura. Now we're going to move to Ms. Abir Abu Zaki. Abir is a youth and adolescent development specialist with over 25 years in the United Nations system, including UNICEF Lebanon, UNRWA, and assignments in Jordan and New York. Holding a Master of Public Health and Health Promotion from the American University of Beirut, she has led national youth policies, life skills and citizenship education programs, youth civic engagement platforms, notably spearheading the Nahnu Volunteers platform. At UNICEF Lebanon, Abir champions inclusive education, youth participation, and life skills development with programming impacting over 24,000 vulnerable adolescents. Her work merges evidence-based public health strategies with youth-focused innovation, emphasizing leadership, resilience, and community empowerment. She is a trusted youth policy advisor and collaborator across ministries, NGOs, and international agencies, ensuring that young people's voices shape national strategies. Committed to equity and lifelong learning, Abir continues to guide youth-centered initiatives that promote agency and opportunity for Lebanon's next generation. Welcome, Abir, and thank you for joining us today.
Thank you. Thank you so much.
So with you, we're gonna dig deeper into the community, particularly focusing on youth. Because youth are agents of change for the future, and it is with them that we should start integrating these mindsets so they can also transfer to other members of their community. We know that effectiveness of interventions that are done at the macro level, such as the ones that Noura spoke about, Pamela spoke about, are often compromised if not coupled with interventions that are targeting directly the affected communities. And this is something that Farah shed light on, Yara, and others as well. How is UNICEF Lebanon working directly with vulnerable communities on the topics of climate change and health? So if you can highlight a bit on the youth programs that you are working on. And can you share some examples of how UNICEF is partnering with local civil society organizations and youth-led organizations to deliver climate adaptive services for vulnerable children and communities?
First of all, thank you so much, and I'm so glad to be here in this beautiful crowd of
expertise in policy frameworks and hopefully in the community also, and we'll see in the discussion that we're having and with the questions to be tackled. Thank you for your question, and I'm glad to be talking about how we are working with the youth who are not only for us the beneficiaries, but they are leads and they are the agents of change, and it is not that they are only the ones who will be affected, they are the ones who will lead the change, and they are the generation that will deal with all the impact that we're talking about. So to start with, linking with the previous panel, we were all talking about frameworks. I would like to draw to the attention of all of us that there is a declaration that was stemming out from the Paris Declaration in COP25 that focused on children and youth, and it is the UN Declaration on Children, Youth and Climate. This is, so to start with, what are the policies that we have to start with, and what we do as UNICEF and in our capacities working in programming, how we should be bridging the gap and taking the macro level being reflected at the lower level so that we don't have these discrepancies and things that are brought from the global north not being implemented or able to be implemented or adapted at the country levels. So the UN Declaration for Children, Youth and Climate is already signed so far by 65 countries all over the globe, and we need to advocate with, as UNICEF, with the governments in order to sign it, and this is a commitment. It reflects on all the other, on the UFCCC and the other frameworks that governments have to commit, but it is focused on children and youth. Having said that, before also talking to you about the youth programming directly on the ground with young people, and how we are collaborating with the different NGOs and local civil societies to work on that, we also have placed and worked on placing and having the voices of young people at policy level. Having worked with youth climate advocates, and I'm glad to see in their video Jana Sabra and Shafi, and these are part, and some of the youth are in the room here with you. These are young people who have the capacities and who have been trained, and they have the passion and the will to change. So they are part of a youth advocacy or advisory groups, and also youth climate advocates for change. They are a coalition, so they work together and they plan, and with them we were able to support them without directly engaging with them what they want to do. We were able to implement for the past 2 years, unfortunately not for 2025, but we implemented the local conference on youth, where they have managed to bring to the table to a document, to a manifesto that goes to COP, that went to COP in 23 and 24, with their aspirations and what do they want to see as young people being implemented for Lebanon. And there are two main things. One that relates to education, and which was touched upon, which is the awareness and the need for educating the communities, the youth like themselves, and the children younger age, and as well to have it as a program that they want to be leading on. The second part is that they want to institutionalize something called a Youth Climate Council, to be advising and to be at policy level with the Ministry of Environment together with other ministries that are working on it. We will be supporting them, and we're trying to support this, and it requires a lot of advocacy and policy work in Lebanon, has a great toll with the difference, with the many different governments that has been like alternating for the past years, and hopefully now we're having more stability. On working with young people, and this is the second part of your question, I would like to highlight that we have worked with those groups of young people together with other vulnerable young people to come up with a package of climate education and advocacy for them to be able to take actions in their communities. And them, like a group of 30 to 60, we started with 30, we're going to be going up to the 60 and getting more and more champions to be leading on education on climate change. And they are working on these with the vulnerable communities reaching out to NGOs that we work with, and sometimes NGOs that are newly recruited by the نحن Volunteers platform, which is the volunteering platform, where those young people go and bring the education or the awareness about climate change and activate other young people like themselves to be taking actions, even if they are small youth-led actions that are in the community. They are making the wave of awareness raising and education that will be taking place within the community. So Greener Lebanon is one of the programs. Working with those youth also on policy level is what we are doing. And not to forget that not only those youth are actively working on the ground, but they also contribute with their inputs to our programs at UNICEF. So in UNICEF, it's not only the youth program that is working on climate, as you rightly said in the previous panel, there are work with the healthcare centers, so definitely in the health section we do work on this. In the protection section, climate is there. It's not anymore that climate is something that is that specialized agencies needs to work with. It's every different section with different stakeholders that are going to be working with them. They will be integrating a component on climate change. So this is in a nutshell what we're doing.
Thank you, Abir. So next I will move to Mr. Qasim Sha'lan. So Qasim started his journey with the Lebanese Red Cross as early as 1993 as an emergency medical technician. The DRR was initiated in 2012 as a pilot in Tyre, Sur. Mr. Sha'lan has been instrumental in the expansion and scaling up of the DRR systematically to achieve national coverage. He has had a remarkable role in enhancing the DRR work, not only at the local level, but also at the regional and international levels. Mr. Qasim is the Lebanese Red Cross Disaster Risk Management Focal Person at the Presidency of the Council of the Ministers and an active member and focal person in several working groups and platforms related to DRR, climate change, anticipation, protection, urbanization, and other thematic topics. He is currently co-chairing the MENA Climate and DRR Community of Practice Working Group. Thank you for joining us, Qasim, today.
Thank you.
So when talking about DRR and disaster risk management, we usually stress, and this is something you stress also about, on the importance of engaging stakeholders not only at the national level, but also at the subnational and local levels, including municipalities, members of the communities, and so on. So can you tell us how is Lebanese Red Cross addressing the nexus of climate change and health and its work with these entities specifically? And if there are digital tools that you are using at the level of Lebanese Red Cross to share this data with other stakeholders?
Sure, thank you for your questions. So my intervention, it will be having two sides. It's part of advocacy to the attendees, where it can be how we really kind of come together through our interventions. And the other part is really to highlight the work that we are doing and the impact and how we can collaborate after that. So I will benefit from this panel for a future collaboration. So, just to give you an overview, as a Lebanese Red Cross, we are playing the role as an auxiliary role for the government as a national society. And again, through the International Federation of the Red Cross and Red Crescent, where we are member of 191 national society, again, we do have our commitment globally to support the government locally. So again, we do committed through Sendai framework to support the government to achieve their commitment. In addition, we are already committed to Paris Agreement and other agreements globally. That will take us from global to local and from local to global. Now again, due to all of the climate change and climate hazard and the disasters due to all of what we are hearing about, flood, earthquake, landslide, etc., we saw, which is really, it came through the UNDRR and other partners, the early warning for all. And it is due to all of the crises, important to be prepared. And there's 4 pillars. One of these 4 pillars, the pillar 4, which is leading by International Federation of the Red Cross and Red Crescent, and it's focusing on response preparedness for the local government and the local institution, where in Lebanon, the Lebanese Red Cross, we are leading in this pillar through close coordination with the DRM at Council of Ministry, where we make sure how we can bring these 4 pillars lead together to enhance and to support the national strategy. By speaking about leads, that don't mean we are doing everything by ourselves. So we are making sure there's close coordination and cooperation through different entities like DRM at Council of Ministries, the CNRS, META Lebanon, etc. So with that said, on the National Disaster Risk Reduction Plan, there is clear role for the Lebanese Red Cross in the preparedness. And during the preparedness, our main responsibility is to provide capacity building to the community through the community contingency plan, community emergency response team, etc. And if we need to do any change, we need to go local. At the level of the ministry, this is where they can set the policies. So again, by the Lebanese Red Cross, we have our presence at the national level. So we are advocating to the policy level. We are taking all this information down to the community level to do the change. And we are making sure the community voice are heard because we are sitting at the level of the ministry and the DRM at Council of Ministry. And this is how we can do the change, and we call it the bottom-up and up-bottom approach that they feed to each other. So that, from the community to the decision makers and from the decision makers to the community. How we do that in practice. So we have the roadmap to community resilience. Through the roadmap to community resilience, we engage with the community through the vulnerability capacity assessment, where it is participatory approach with the community. When we reach the community, we do stakeholder mapping, stakeholder analysis, we look at the influencers, and we put all of them together. So the community speak about the hazard and the vulnerability through the multi-hazard approach. So we don't go to speak only about climate change. So communities, they speak about the multi-hazard that they are facing. Because the communities, they cannot address the climate by itself. They will say, we have less rain, we have more winter storm, we have heat wave, etc. Then through our communication, coordination, we are putting them into categories. And based on that, we start with something we call it community action plan. And we are looking at the existing capacity at the community level to start to do that change. But again, in order to do the change at the community level, you need to work with the existing system. And the existing system here, in addition to the DRM, you have the relevant ministry. So we have the Ministry of Public Health, Ministry of Environment, Ministry of Agriculture, etc. With that said, how we are contributing to the part related to the climate health part. In coordination with the surveillance unit at the Ministry of Public Health, we are working on a community-based surveillance. Community-based surveillance is for early detection, early action. And we knew due to the climate change, we are seeing it's more diseases are taking place. And the important part is in order to have early detection, then you can have early action, and that can contribute a lot. Due to our community engagement and our trust and our national coverage, we were able, within less than 2 years, with the ministry to cover 600 municipalities. This is not a small number. How we done that? Because we built on what we've done during COVID-19, during cholera, during Beirut blast. So then, all this learning, coordination, cooperation with the local authority, they seen impact, they seen change, so they are happy to get engaged. The community, by engaging with the Lebanese Red Cross, they knew that their voice will be heard. They knew that will be bringing answers. I'm not saying we'll be able to provide solution for everything, but at least we are making sure to link the dots together. And again, by doing coordination with other INGO or UN for any project that they have that they can contribute to the community level. With that, we again contributing to the anticipatory action. So we are working with the CNRS, META Lebanon, DRM. We already set the triggers for the winter storm. Now we are into ongoing discussion to set the triggers for the heat wave. We already done the study for the urban heat map, and again now we are setting the triggers for the heat part, and that again required more coordination at the community level, and there's ongoing coordination with the Ministry of Public Health as well. Due to the successful of the community-based surveillance, now we are into ongoing discussion with the ministry through the One Health approach that they already committed to, is to integrate the anticipatory action, and we choose the hepatitis A as the one to set the policy for that. Again, how we engage the community more specific for other element related to climate, it's through Why Adapt. I mean, you can Google it, it's youth-led initiative. So we do through 8 courses with the youth group, and based on that, the youth, they start to engage and to find solution at the community level. But since we are already integrated with the local authorities, so we are making sure we are doing these linkages in order, so the youth, they are able to do something at their community. The authorities, they are helping and doing some facilitation. And we do have some fund that we can provide to this youth. It's not cash, it's like, aids in order to do that change. And again, in addition to the community emergency response team that we create, in addition to the community contingency plan. So why I'm highlighting on a community contingency plan? And I'm really glad to hear, climate change, it's not a standalone. I mean, climate change, it should be integrated. And globally, we are always see DRR/CCA, so DRR, climate change adaptation. It's really always about adaptation. So, and by working with the existing group at the community level, tackling everything at the same time, doing the linkages with the right entity here, how we can do the change. So my advocacy here for everyone involved on this, we are always want to pilot new things. We don't need to pilot. We are expert in this country. We know what we are doing. I mean, there's really a lot existing. I mean, the thing which is really what we are facing, and if you allowed me just to be open for this part, is who will be the star? It is not for me, it is not about who will be the star. I mean, all what we are doing is to achieve more and safe disaster resilience community through collaboration. So our main target is really the most vulnerable group at the community level. So it's very important, before we do any intervention, let's to see what is existing. Let's to look at the National Disaster Risk Reduction Plan. Let's to see who's doing what. And based on that, build on existing structure. Build on existing initiative. Sometimes, we get really unhappy when we do community engagement. We see organizations, INGO, UN, they are coming to do things which is we already established. You are looking for information which is we already have. You are creating another group which is already existing. And then you do your implementation and go. At the end, for us as a Lebanese Red Cross, we are from and within the community. We stay. When we speak about localization, it's really very important to invest on the existing structure that they are there to support the communities. Then the last point, actually there's a lot to speak, but just due to the time, I will stop here for this element. I will shift to the digitalization. So again, through our focus group discussion with the communities, when we talk when we take from them the capacity and the hazard, our team, we are using the ArcGIS, and we are using the survey 123, and based on that, we go down with the community and we map all the capacity. We have 33 data collection survey for all of the capacity, in addition to the hazard that the community are identify. Then we are putting these layers together, and we use the model at the GIS to do the analysis in order to help the community to take the right decision. And we are using this information not only for the response, to help the local authority to take the right mitigation measures that they need to take into consideration. And we use this data, we support the ministry during cholera, because when we have all the data and they need to vaccine everyone in the selected governorate, so we're providing the data collected and we map it in order to make sure there is no one left behind. So again, coordination, cooperation, and there's really too many examples. Even the ongoing project with the vaccine with the Ministry of Public Health and UNICEF as well, we are using a lot of this tool. So, and again, through story map, again, we are using this tool as well. Thank you.
Thank you so much, Qasim. You highlighted a very important point, that is complementarity. We should not be reinventing the wheel every time we want to do something. We should be very knowledgeable about what are the existing projects, who are the current key active players in this realm, and then think how we can collaborate and complement each other's work. So to conclude this panel, we're gonna end with Mr. Fadi Dweik, who's joining us online. Hello, Fadi. So Fadi is a climate resilience technical advisor at Save the Children International, supporting programs in Palestine and Egypt. He leads the integration of climate change adaptation across sectors such as education, health, child protection, food security, promoting cross-sectoral resilience strategies with over 15 years of technical experience. His expertise spans climate vulnerability assessments, water resource management, GIS, and strategic planning, particularly in fragile and conflict-affected settings. So, welcome, Fadi. Thank you so much for joining us. Wish you were able to join us physically. So, as Save the Children, what are the main challenges in building climate resilience in areas already dealing with political instability, such as the ones you are working in? And how can humanitarian organizations transition from reactive to preventive programming when it comes to climate-driven migration and health shocks in such settings?
Hi, everyone. Thanks a lot. It's a privilege being with you. I hope my voice is clear. It's really important to discuss this kind of important issue, mainly on climate change, migration, nexus, health, at the same time of conflict. Since like my background is in technical point of view, I will be working on technicality. I will just like mentioning all the time figures and numbers. But at the same time, since we are at Save the Children, working mainly to support the children, which is, I think, one of the most important, let's say, category that we just didn't mention during the 2.5 hour during our discussion. Climate crisis is considered as a child right crisis, which mainly Save the Children and UNICEF agree on that, mainly on the terminology. Why we are saying that? Because in general, as we can say, children have done nothing in order just to cause this kind of climate crisis, but they are at the most affected by it. Recent research is done by Save the Children technical people at the same time with our advisors and with the University of Brussels in Belgium. We're just like making a study on the impact of climate change, mainly on children. But at the same time, we compare it with people actually born in 1960. So at least we can compare this kind of people, like this kind of, let's say, extreme weather events and hazards that are actually impacting. And the results actually were shocking because actually children born today will actually experience an average of 2 more times of wildfires, 2.8 times of crop failure, 2.8 times of more floods, 2.6 more droughts at the same time, which is actually a shocking 6.8 times of heat waves, which means that you will find more than 100 million of children actually impacted. At the same time, we should not neglect people with disabilities. So if we're just mentioning about the heat waves, maybe we are exceeding 62 million children will be highly impacted if we reach the tipping point of 1.5 Celsius centigrade. At the same time, for the crop failure, you will be reaching 23 million will be impacted. River floods, 10 million. Tropical cyclones, almost 7 million. Wildfire, 9 million, and drought is 6.4 million. Therefore, and Save the Children, we have different type of pillars. One of them is actually focusing on health, which is healthy start in life. So we are actually targeting children below 5 years old. On the climate component, we just like working with them to understand the climate change impact on their health, at the same time on the climate resilience health system with the communities, because I think one of the main pillars to work is just strengthening the communities to be ready to face any disaster risk or any climate change that they have it. At the same time, in order just to enhance the health facilities and the nutrition through natural-based solution. Therefore, in order just to tackle all of these kind of issues, and mainly because I had the experience working with, like, say, conflict areas, like I'm currently now in Palestine, and we are actually serving as one of the most humanitarian, actually, let's say, international organization working in Gaza. We have so many challenges actually based on the climate resilience in areas that have this kind of things, which is the most important thing is restricted access and mobility, which is till now when everybody can see the siege on Gaza that we can't even having a small part of access for, let's say, humanitarian aid, which is actually based on military, it's like checkpoints and, blockades at the same time. The problem that we are facing is not just even the war, in addition to the climate part, which is actually we don't have the access to water resources, we don't have actually the essential services, which is actually having a different type of impacts on the people themselves. At the same time, we have a problem in fragmented governance and actually weak institutions, which is mainly that we can face it in West Bank and Gaza Strip. The weak governance actually embedded based on the coordinated for the climate action, planning, and long-term resilience investment. At the same time, for the national climate adaptation plans, which is actually all the time underfunded. So as you can see, now there's a different type of priorities in order just to work on a humanitarian, so at least to have the life-saving aids in order just to be there. At the same time, one of the challenges actually the displacement and the loss of livelihoods, which is actually not just in Palestine, you will find it in Yemen, Iraq, even in Lebanon, at the same time in Egypt, where even I'm just like leading the climate change work there, which is having a huge displaced population at the same time, which is living in a fragile environment, which is actually having a minimum access of sustainable resources. At the same time, the resource scarcity and environmental degradation, which is mainly that you can't just witness from the climate change impact from the heat waves, as like even our colleagues in the panel they already mentioned about like Icarda, they mentioning about the impact of the water resources and actually on the agriculture productivity, which is actually, in our case, it's the added part is actually the political status that you are facing on that. At the same time is the humanitarian development divide, which is mainly now as the cases and we have it in the conflict areas. Everything is going attention for the immediate relief rather than just a long-term resilience investment, which is actually we are doing in parallel at the same time with not just like even the CSOs, we are actually even working with strengthening even the CPOs in order just to be sure that even the exit strategy from our work with these kind of communities that has the value. So whenever we are out of the community of that we are working with, we assure that the people inside the community, as they mentioned, maybe Mukhtar or something like, it's like main stakeholders, community leaders, and even the activists from the youth and even from the children that they can be paralleling these kind of things. At the same time, the problem of the data and capacity. So in general, whenever you have information from the climate data and when you with the fragile status and at the same time for the conflict areas, it's not easy to collect information and data. So because of that, you just like relying on the modeling, which is like a GIS and remote sensing items. So at least you can just like collect the information and do these kind of scenarios, which is actually a very important point for us for the early warning mechanism and anticipatory action. And the same time is the donor constraints. As you can see, like in the previous, like let's say 2 years, we already faced like in Palestine, different type of, let's say, cut off of funds due to like a political status of like the donor. They don't want to go in this kind of things because, it's like, it's really sensitive. But the most important question is, as like Save the Children, as working on the humanitarian organization, how we can make this kind of reactive to preventing a program, which is very important since we already have a Save the Children global humanitarian strategy, which is actually focusing on early warning system and anticipatory action, mainly for droughts, floods, heat waves, and all of these kind of things. And we can witness it actually not just in Palestine, you can see it in Sudan, in Yemen, in Iraq, in Egypt, and all of these kind of things. So because of that, we have a special type of climate-informed hazard mapping system at the same time with the climate vulnerability assessment post. At the same time, during the humanitarian access, we have a pre-position resources that at least we can base on the seasonal climate forecasting. And we have a very strong modality, which is the MPCA1.
If you can wrap up in 1 minute just for us to take Q&A, please.
Yep. And the most important thing is about the triggers for cash flow resilience, which is very important item for us. At the same time, which is I agree with all the people who are mentioning, which is about the integrated of climate change with the actually multi-sectorial programming. So it's not just like an standalone, it's a cross-functioning with child protection, education, health and nutrition, food security, which is actually informed the climate-induced migration and displacement risks, which is actually very important in order just to be addressed. At the same time, which is for the advocation, which is like advocate for climate finance mechanism. And it's known that Save the Children is one of the accredited, let's say, entities that they can apply for the Green Climate Fund, which is actually helping even the governmental entities, like a Ministry of Environment in Palestine, at the same time, Ministry of Environment in Egypt, in order just to work on enhancing the impact of climate change in their communities through this kind of funding. And in order just like to close this kind of things, education is very important because my colleague in UNICEF mentioned very important thing. And I think even our office in Lebanon, they are like functioning now something called Green Generation. It's an environment and educational material for like students from third grade till the 10th grade in order just to educate them about the importance of climate change and what's the impact on that. At the same time, for the local conference of youth, we fund them in 2024. And I think even UNICEF this year in Palestine, they fund them for 2025. We already pushed the advocate for them. So we already participate like different than more than 25 to 30, let's say, children. They will participate in the conference of parties in Sharm el-Sheikh, and at the same time, even in Azerbaijan the last time. So this is like in the main cases that Save the Children is working under this kind of thing. And I would just like not taking so much time. Thanks again, and I will be open with even the panelists for any type of questions.
Thank you so much, Fadi, and we truly appreciate that you are joining us online from Palestine. We really appreciate that. So we're going to open the floor for 10 minutes of Q&A. Dr. Doumet.
Actually, it's not a question. Thank you very much for all the panelists. We would like to highlight that we're talking about, of course, women, children are vulnerable population, but poor, because we have two kinds of population. We have the rich, even if they are women, in the midst of any climate change or disaster, they can travel, they can change house, they can get all medications, and the same applies to children and to even men. We don't want to discriminate here, but we have to emphasize that we're talking about the underprivileged population, whether they are children, women, or you name it. Thank you.
Okay, again, thank you so much. I have one question to Mr. Asim, please. As you know, wildfires have become increasingly frequent and severe in Lebanon. How is the Red Cross wildfires? How is the Red Cross engaging vulnerable communities to prevent and respond to wildfires? And are there ongoing advocacy to the local community, local authorities like municipalities or ministries? Thank you.
So do you want to answer the question now? Go ahead.
Yes, so as we mentioned, through the multi-hazard approach, there is already ongoing initiative. It was taken by the Ministry of Environment, and even today they launch it as well. So what we do contribute is when we are raising awareness at the level of the local communities and the local authorities about the forest fires and how they should behave as well. Second, we do train the local community as a community emergency response team, like from the local community, and we provide to them basic equipment that they can be as a first responders. And at the same time, what we are doing, we already mapping the local resources, like, water trucks, etc. When you activate the community contingency plan and you have the first responders, then later on you will have the fire brigade, civil defense, and even Red Cross, but the first they are the local communities. So then they can benefit from the local resources that they already have. And we trained around plus minus more than 100 municipalities on this response preparedness. And if there's any local authorities they have interest, please reach out and we are more than happy to support.
Hi, my name is Zaina Aitani. I'm a public health consultant here in Beirut. I had a question for Asim as well as Abir with the work that you do with communities and youth and assessments. Mm-hmm. Asim, you said about multi-hazard assessments that in your experience with the Red Cross, the communities or people don't talk about one risk, it's multiple risk. Mm-hmm. And if this question covers other people, please respond. Mm-hmm. What I'm wondering is in assessments and discussions, Red Cross, UNICEF, others, what hazards do especially youth talk about? If you talk about climate, but there's multiple things, what comes up? What is expected and what is maybe unexpected? That are brought up as these are related to climate hazard and it affects me and my community, but maybe you did not think it was climate, mm-hmm. if that makes sense. So I often worked in sexual and reproductive health. So for example, if UNFPA is saying in displacement that might be climate related, access to health services or menstrual hygiene becomes a risk. Many people wouldn't think of that as a climate-related hazard, but maybe communities bring up health as a climate-related hazard. I'm saying, what are the bigger definitions that come up when you assess and work with communities around climate? Sort of in that multi-hazard perspective.
Yeah. So, again, as I mentioned, so one of our power we do have as a Red Cross when it comes to the community, we are very strong when it comes to the community engagement through the vulnerability capacity assessment. So what does that mean? For us, the important element is really before you start the assessment to choose the right group to start with them. First thing, it comes to the community when we do the assessment is really the poverty, is really the, so this is the first thing they come. Second element, they start to speak about winter storm, heat wave, landslide, earthquake, road accident. They speak about whichever. So because as I mentioned, we don't go from climate change angle. We go from climate. As a community, you have the freedom to speak about all the hazards that you are facing. Based on that, our expert, they put them into categories, and we start to provide solutions for the communities. But again, when it comes to the climate-related part, we are one of our modality is you can integrate the climate through livelihood programs, for example. At the urban, you can work with urban roofings, etc. Then you can create job opportunities as well. So this is how you can engage. But in order for the community and the youth to engage with you, one important element, you need to have the trust, and you need to show result on this element. I'm not sure if I answered your question.
Yes.
Yeah.
I'll try to complement here. Yes, I'll try to complement here. Thank you for your question. Indeed, as you're saying, so as also Asim mentioned, it's not necessarily categorized by the people as climate, but they categorize them for us. We just take them as these are the most needed things. We do work with them on them. What is usually coming with the needs assessments that are conducted in a participatory approach by the young people who are not the most vulnerable, but they do reach out to the most vulnerable. So they are the agents of change that are trained, but they go and train others and engage with the communities at community level with different, whether in municipalities or in public schools or in the different communities through our CBOs or NGOs that we work with. What has come up recently and and I will mention what Asim has touched upon on the livelihoods and other things, but what's usually coming is the mental health, anxiety about the climate, and it's particularly coming from the age groups that are the adolescents and youth, and I tap onto what my colleague from Save the Children mentioned, because to them, the toll is huge, and it is something that they are anxious about. It is something, it's a longer life that they will live with this problem. So when you talk to the communities, to the adults, to the 40-year-old, 50-year-old, they've already achieved, they are in their livelihoods, but for the children, they see that the impact is getting stronger and their life is longer. Is it going to be a long life with what kind of quality? So a lot of the discussions that come up with from the communities, particularly adolescents and youth, is anxiety and how is this really affecting and how they will be dealing with this. So this is one thing. On the other component, as based on the needs, when we are tackling different issues, and this has been really tackled, and our partner with the Red Cross as well, during the crisis. So young people during the crisis, we were able to touch upon their anxiety and respond to their needs of being really safe and protected by engaging them in the livelihoods and in the support of providing the response, being part and taking lead in the response, whether it's in the crisis or in how they can be productive and focus on what they can bring to the table based on the needs of during the war. For example, getting them engaged in skills that they can learn where they can be productive and focus on bringing about something and being productive rather than just being anxious or just a recipient on the war toll or other things. So they were able to distribute themselves, they were able to distribute the aids, they participated in distributing the aid in producing winter kits, summer kits, and all these kinds of things that they can learn in order to be able to be agents of change and reducing on the anxiety and mental health level.
Can I add something? 1 second. UNFPA recently launched globally the State of the World Population Report. And one of the things that came out from the report very strongly is that young people in the decision about their families and how many children they have a lot of anxiety on uncertainty in the future. And one they brought up, it was also climate change. We discussed this with young groups in Lebanon, and we say, I'm not sure this play in Lebanon. And this came out as well, even from young couples in Lebanon, thinking about how many children they want to have. The economic insecurity was the first, but they also brought up the climate change and how it's changing the life in Lebanon.
Thank you so much, Pamela. Thank you for all those who have questions. We can address this during the lunch because we are out of time. We're going to move towards formalizing this whole commitment to climate change, health, and migration with the signing of the MOU between the Global Health Institute at AUB and IOM Regional Office for MENA, and then with closing remarks from Matthew, and we will go to lunch. Thank you so much for joining us. Thank you.
Thank you for this.
Thank you.
Thank you for this fruitful panel discussion. Before we officially close, we are pleased to announce that the Global Health Institute at the American University of Beirut, represented by Dr. Shadi Saleh, and the International Organization for Migration, represented by Mr. Matthew Luciano, Head of Office in Lebanon, will now proceed to sign an MOU to foster future collaboration and advancing shared goals across both parties. Dr. Saleh, Mr. Matthew. Congratulations on this. This brings our event to an end. Thank you for your participation and attendance, and please feel free to join us in the lunch. Thank you all. Apologies for this. We're now going to hear closing event remarks from Mr. Luciano.
Thank you, and sorry to stand between you and lunch then. So dear colleagues, dear panelists, dear partners, dear friends, it's really a great honor to close such a rich and forward-looking event. So on behalf of IOM, of the International Organization for Migration, I would like to extend my appreciation to all of you who contributed to today's discussions, from academic institutions to UN colleagues, civil society organizations. Your expertise, critical reflections, and shared experiences have reaffirmed the urgency and complexity of the climate health migration nexus. So today's event marks more than a knowledge exchange. I think it represents an important step forward in shaping multi-sectoral partnerships. We're particularly proud that this symposium was organized in collaboration with the American University of Beirut, a leading institution in public health and policy research. So thank you very much. As climate change accelerates, the world is witnessing rising temperature, extreme weather events, which we've talked about, and increased environmental degradation with serious consequences on the health of individuals. These impacts are disproportionately felt in vulnerable regions, such as the Middle East and North Africa, where climate fragility intersects with displacement, conflict, and already stressed health systems like in Lebanon. Migrants, especially those displaced by climate-related events, often face reduced access to health services, poor living conditions, and exposure to new health risks across borders. These vulnerabilities call for integrated approaches that ensure that public health preparedness, continuity of care, and regional cooperation. IOM's experience on the ground, which my colleagues actually explain in detail, highlights that mobility can be managed safely and health can be protected when systems are resilient, inclusive, and adaptive. This is why our partnership with AUB Global Health Institute is so timely and so relevant. The signing of the MOU represents our mutual commitment to deepen collaboration on climate-related health issues and also on advancing the broader health dimensions of human mobility. The MOU we just signed formalizes a shared vision to strengthen research, policy, and capacity building that links climate change and health within migration system. So today's symposium and the signing is just a beginning. We're pleased to announce that this discussion will continue through 2 upcoming webinars in the coming month. These sessions will further explore critical dimensions of the climate health migration nexus, discuss best practices from the region and beyond, and create a platform for continued learning and action. In closing, I'd like to insist and leave you with 3 key messages. The first one is that we need to act now. Climate-driven health and migration challenges are no longer future risks, they're current realities that demand urgent and coordinated responses. The second message is that we need to work together. Universities, UN agencies, civil society, and governments, which each hold part of the solution. Only through partnerships and shared knowledge can we craft integrated, sustainable, and efficient strategies. And the last message, as IOM, is that we must center migrants in our response. Policies and systems must be inclusive of those on the move, and they must ensure equitable access to health and protection for all. So I would like to thank you once again for your commitment, for the partnership, and we look forward to working this path together, again with evidence, with innovation, and solidarity. Thank you.
Thank you, Mr. Luciano. This for real brings our event to an end. Thank you all for your attendance and the participation, and please feel free to join us in the lunch. Thank you all.